Welcome to the International Conference on Injury Prevention Sri Lanka 2023, organized by the Directorate of Non-Communicable Diseases, Ministry of Health, Sri Lanka. Similar to yesterday, we have a diverse and exciting program for you, featuring eminent speakers, panelists, and presenters from various fields and backgrounds, who will share their expertise, insights, and experience on how to prevent and manage injuries in different settings and contexts. You will also have the opportunity to interact with your fellow participants, network with them, and learn from the best practices and innovations in injury prevention and control. There will be 3 simultaneous sessions here in the Grand Ballroom, the Link Hall, and the Albatross Hall. We are here at the Grand Ballroom. The Link and the Albatross Halls are at the ground floor. We hope you enjoy this conference and find it valuable for your professional development. Now it's time to break out. If you wish to go into Albatross or Link Halls, now it's time to break out. The session on the Albatross Hall will focus on elderly safety, and the session on the Link Hall will focus on animal safety. Please feel free to break out now. And let's begin the Symposium 7 of the Grand Ballroom, which will be focusing on drowning safety. The theme of this symposium is Embracing the Waves of Safety, Advancing Drowning Prevention for All. To chair this symposium, I respectfully invite Mrs. K.V. Suranga Premani, the Director General Planning, Ministry of Tourism, and Mrs. Kalyani Heva Patirana, Director, Fisheries Operations Division, Department of Fisheries and Aquatic Resources. Dear Madam, please be on the stage. Over to you, Madam.
Good morning. It's a great pleasure to attend this important conference today. I welcome all of you to this important symposium on drowning safety. This is Embarrassing the Waves of Safety, Advancing Drowning Prevention for All. It is an honor to stand before you as we come together to address a critical issue that demands our collective attention and commitment. Drowning is a global concern that touches lives in every corner of the world. It also leading cause of death in Sri Lanka. Today, We have entered a turning point in history. It is a timely need to explore innovative strategies that propel us forward the future where water-related strategies can be significantly reduced. The theme of our symposium shows our shared commitment to advancing drowning prevention measures for everyone, regardless of age, background, or circumstances. This symposium serves as a collaborative platform for experts and advocates to pool knowledge and experiences. We aim to create a comprehensive understanding of drowning prevention and pave way for effective evidence-based solutions. Actually, the water safety and drowning safety is a highly important subject to the Ministry of Tourism. Being a tropical island nation, Sri Lanka is an attractive tourist destination for tourists all over the world. The tourism industry in Sri Lanka is blessed with plenty of beautiful water environments, and approximately our hotels, 70% of hotels are situated near the beach, relying heavily on coastal beauty to attract tourists. Unfortunately, 6 lives have been lost in this year due to drowning incidents. Therefore, it is clear that we must prioritize and improve our approach to water safety. Water safety isn't a one-size-fits-for-all solution. Different water environments, whether it is an ocean or swimming pool or a river, require tailored approaches. As you know, the tourism industry is a significant contributor to Sri Lanka's economy, especially providing employment opportunities directly and indirectly more than 2 million people. If there is some issue, a decline in tourism numbers means reduced income for the hotels, restaurants, and the business from our backbone of our tourism industry. This impact trickle down to the livelihoods and countless individuals and commitment reliant on tourism in their income. By investing in comprehensive safety measures, conducting a regular awareness and campaigning and providing proper training for all tourism staff, we can create a safe environment that ensure well-being for our visitors and preserve the positive reputation of our tourism destination. As a line Ministry of Tourism, we are prepared to offer our fullest support and this endeavor to ensure safety for tourists. Thank you.
Good morning, everyone here. Now we are going to start to introduce the speakers for this on the topic of drowning safety. The first speaker here, Dr. Mahanama Gunasekara, Comprehensive Water Safety Solutions, emphasizing the importance of multi multifaceted approaches to water safety, addressing the various water environments, age groups, and activities to create a comprehensive drowning prevention strategy. The second speaker, yeah. So I am very glad to introduce Dr. Mahanama Gunasekara. Dr. Mahanama is an esteemed consultant general surgeon based in the National Hospital in Colombo, Sri Lanka. He has made significant contributions to the field of surgery throughout the illustrious career, marked by his commitment to excellence, leadership, and dedicated to the medical profession. Dr. Gunasekara began his medical journey by obtaining his MBBS with second-class honors from the Faculty of Medicine, Colombo in 1990. He further demonstrated his academic powers by earning his Master of Science in Surgery in 1997, which earned him the prestigious V. Gabriel Gold Medal for Surgery. Driven by his passion of continuous learning, he went to achieve FRCS Edinburgh and FRCS England in 1999, solidifying his international expertise. As a consultant general surgeon at the National Hospital in Colombo, Dr. Gunasekara has been a beacon of excellence, providing top-notch medical care and leadership. He served as the president of the College of Surgeons of Sri Lanka, which is testament to his esteemed standing among the peers. Dr. Gunasekara's contributions extend beyond his clinical practice. He has been honored with the title of Honorary Senior Lecturer of the Faculty of Medicine, Colombo, since 2015. In 2018, he has acknowledged for his exceptional service to the Sri Lanka Air Force with the commissioning as Honorary Group Captain. He is recognized as an Honorary Fellow of the College of Physicians and Surgeons of Glasgow and the Association of Surgeons of India, which solidifies his international reputation. As a committed academic, Dr. Gunasekara is a member of the Board Study of Surgery PGIM and a part of court examiners in MRCS at the Royal College of Surgeons of Edinburgh. His involvement in sharing the future of surgery showcases his commitment to the education and training aspiring medical professionals. Dr. Gunasekara's service to the medical community extends to rural regional hospitals throughout Sri Lanka. His expertise in managing combat casualties during war since 1990 reflects his commitment to the providing critical care in challenging circumstances. He continues to contribute to the well-being of the nations as an honorary general surgeon to the Sri Lanka Air Force since 2013. His commitment to the medical education is evident in his roles as a course of instructor in the primary trauma care, national trauma management course, and laparoscopic skills course. These roles highlight his dedication to sharing knowledge and enhancing the skills of medical professionals. Outside the medical realm, Dr. Gunasekara is a bird watcher and traveler, finding solace in nature. His passion for swimming is not only passional interest but also reflected in his role as the honorary chairman of advisory board for the Sri Lanka Swimming Coaches Association. Dr. Mahanama Gunasekara life and career stand as a testament to the profound impact one individual can have on a medical field and the broader community. His principles of excellent service and continuous learning are truly inspiring. So, Dr. Mahanama Gunasekara, I cordially invite you to address this forum.
Thank
Thank you very much for that very, very kind, very long introduction. I didn't expect that much of long introduction. And thank you for being with us in this collective effort. And I'm very happy to see that two of you are from the Department of Tourism and then in the field of fisheries, the Ministry of Fisheries, where these collective efforts to reduce the deaths due to drowning effort is concerned. Firstly, as the First Lady who spoke mentioned, Sri Lanka is blessed with enormous amount of water. And especially we are surrounded by warm blue sea. And then of course there are multiple freshwater rivers draining from the central mountains to the whole circumference of the country, as well as various water bodies, especially irrigation water bodies which are coming from ancient times, ancient tanks, canal systems, and then of course the modern large dams and reservoirs. This is obviously a huge economic asset. At the same time, it adds to the beauty of the country. The beaches, as we mentioned from the beginning, so our sea is one of our main resources where we produces seafood, and its fisheries industry had been going on for many thousands of years. And these beaches attracts tourists from all over the world, and therefore our beaches are famous, and we have to maintain the safety here. And they are excellent locations for recreation activities, which includes many sports. And then of course the sea freight and the sea-related transport services, especially boating, which it poses a potential risk of drowning all the time. And in spite of all these beauties and these benefits, it's a potential danger to those involved in these activities. As I mentioned, there are 16 major rivers which drain from central mountains to the different parts of the country, each of which are more than 100 kilometers in length, and you know the longest being Mahavali, more than 300 kilometers, which travels across the many villages and cities. And similarly, there are 24 other intermediate level rivers, which some of them drain into the sea directly or draining into these major rivers. So along this, there are innumerable hundreds and thousands of other tributaries which join on their way. And while doing that, it's cascading through the mountains, down the mountains, and going through the villages. It forms multiple beautiful waterfalls and natural pools, which naturally attracts youngsters with very little training in swimming or water-related sports. And similarly, passing by travelers who have very little idea about the location and the regional dangers that are involved, so they get immediately attracted to these natural pools, and they are in great danger. Similarly, nature lovers, I'm sorry about the spelling, something has gone wrong there, and nature lovers who venture into these locations for photography and similar activities also are in danger. And these rivers, as I told you, as it passes along the villages, that becomes their major water resource. And they reach these places for their daily needs and as well as recreation. And then again, these river edges are used by travelers for recreation as well as bathing on their way. And when it comes to drowning, Sri Lanka for many years had reported about 800 deaths per year. That is quite a significant number. Over the last few years, thanks to the life-saving organizations in the country, and then awareness campaigns, we have managed to reduce it a little. And the 2016-18 reports that's the last available to us, records 3.5 deaths per 100,000 population, which is very high number compared to the rest of the world. And the males are highly vulnerable. Male-female ratio is almost 2:1. And I got most of the statistics from the life-saving, Sri Lanka Life-Saving, their website, and their report on drowning incidents in 2020 is a comprehensive document which gives you many data about regional statistics of drowning. And if you study this, I'm sure you can see, I have taken these notes from to this side for you to read. And you have the highest number of deaths reported during these 2 years in Western Province, obviously because that is the most populated district. As a result, the rate of drowning is recorded as low, but the number is quite high. And similarly, Southern Province and Northwestern Province and Northern Province have very high drowning incidents. And you can see, I have just mentioned the commonest cause of drowning first. So you can see what are the reasons in different parts. And the seawater drowning is common in the coastal areas, whereas the lakes, canals are the killer in the dry zone. So it is essential for us to have an understanding and aware about the statistics and the pattern of drowning in each and different areas of the country in order to address it and prevent it. So when you are planning, one of the most important document that we need is on data on drowning. That data should include various water environments where the drowning takes place, as we have mentioned already. You can see on your right-hand side, Sri Lanka is one of the highest. Probably we stand at the 15th, number 15 when it comes to the number of deaths per 100,000 population. And then similarly, we got to identify the different age groups which are vulnerable, the gender, occupation, and various activities that they are involved in, and take precautions to prevent. And similarly, education and training should be targeted the involved population, and therefore, again, that is where the statistics matters. And developing resources include capacity building and developing standard guidelines and protocols. And there should be a national plan integrating all these departments where all stakeholders involved in drowning, the water activities, and then address drowning prevention as a nation. And all these measures to prevent primary prevention of drowning, and at the same time we should take measures to reduce the drowning, secondary prevention in drowning, that is people who have near drowning, how to deal with them and save their lives. And of course auditing is necessary, that is to study whatever the measures that we have taken and how it has been effective, and what is the impact on outcome, and how to improve from there to reduce drowning incidents further. So when it comes to drowning in sea, you saw in the previous statistics, in Western, Southern and Eastern Province, the commonest cause of drowning is related to sea activities. So these includes mainly fishing, and in addition to that, sports such as snorkeling, skiing, and various other sea-related sports, whale watching, and tourism industry also promote all these recreation activities, and of course the sea-related transport, as I mentioned earlier. And the Sri Lanka Coastal Guard website reports that they have saved 233 lives of near drowning incidents, and most of them were tourists. And you can see how important these life-saving organizations in reducing the deaths due to drowning. And as you already noted, in Jaffna Peninsula, in northern the province, and especially Jaffna Peninsula, the commonest cause of drowning was related to their wells, agriculture wells that you use. This is the type of well they use. So this is how you can see, just imagine, the large number of wells that are located in the Jaffna Peninsula alone. There are thousands of them everywhere. So these wells, why do they get drowning, how it happens, and how to prevent it, and most of them are highly unprotected wells. So therefore, that is one area we have to address to reduce this drowning. 7.3 per 100,000 population in the northern province. And again, Sri Lanka boasts of one of the oldest agriculture related waterworks. So therefore, we have innumerable number of ancient tanks, plus modern dams and reservoirs that are located particularly in the dry zone. So in R.L. Bohia reported about 6,000 tanks only in the North Central province. So that is one of the biggest sources of water in these areas. So therefore, people naturally have to depend on them because they have very little rainfall and all this water coming and stored in these tanks. So they are highly vulnerable. So they use it for their domestic needs and bathing, washing. And of course, they are used by the travelers as well. Again, travelers have very little idea about the depths and the dangers involved. Similarly, they are the only water bodies in most of the areas available for their recreation, sports, and sometimes fishing as well. So the guidelines for individual safety has to be promoted because each and every individual, every citizen is responsible for himself or herself as well as those around him. So one of the most important things is to learn to swim. In a country which is surrounded by sea and water everywhere, everyone should be able to swim for that matter. So unfortunately, very small percentage of people in this country can swim. So swimming can significantly reduce unintentional drowning. And other thing is we got to promote wearing life jackets. The life jackets were available in this country. They were being manufactured in this country for quite some times. But unfortunately, last few years, I find that they are very difficult to find. So these are some of the industries that we may have to promote. And at the same time, people should follow the guidelines. And we don't have enough guidelines displayed in these vulnerable places. Whenever it is there, we should encourage them to read the guidelines. So one of the proposals was to have a common logo under which these guidelines should be given to all the people who visit these vulnerable places and be displayed, and people should identify the guidelines from that type of a known symbol. And even if the guidelines are not available, people should follow common guidelines given by instructors and lifesavers. And alcohol had been associated with 10% of deaths due to drowning. And I told you it is mostly males who consume alcohol in this country. So taking alcohol even in small quantities is extremely risky when you are engaged in water-related activities. And children, particularly first 4 years of life, are highly vulnerable even with small amount of water. So children should be supervised all the time, and particularly when they are engaged in water-related activities. And then one has to be, particularly when you are using natural water resources, especially sea and the rivers, one has to be vigilant about tides and the currents. And at the same time, especially rivers, there could be sudden increase in the water currents because of raining in somewhere else. As I told you, these rivers have this cascading from the mountains. Sometimes it rains in the mountains and the water suddenly comes into the low areas and people are unaware of it. You have to be vigilant. And there should be some group leader who knows these patterns all the time. At the same time, there are people situations where commonly drowning can take place because people unsupervised pools actually be dangerous. So there are no lifeguards, sometimes there are no barriers marked, and where the deep end is, where the shallow end is, what is the depth, and one has to be quite aware of the situation in the swimming pool. At least the basic places are the lakes and the oceans. So in these places, there are people who are not therefore they should not particularly without instructors or without capable people who are capable of saving lives. All those people who can swim cannot save somebody who is being in the Department of Health, and it was spearheaded by Dr. Samitha Siritunga, and I was lucky to be a participant of that workshop, and where the all stakeholders in different sections of the country participated in, because this drowning transcends all communities, all ages, all professions in the country. And one of the three areas that we identified during this session was one is to take measures to reduce drowning in unsafe water bodies. Second is to increase awareness and skills in the community. Third is capacity building in the workforce and the staff members, particularly in industries related to the water activities. So these are the few things that we identified and discussed during our sessions. One is the mapping of black spots, where the dangerous places should be known. And when you enter a new way, when particularly travelers and tourists go to a different location, there should be warning place, there should be signposts and mapped out areas where there is danger and which is not totally unsafe to get into waters and swimming. And similarly, safety standards activities. And the the topic that we discussed was the awareness and skills among community. As I told you, every child should have an opportunity to learn swimming. So therefore, we have to identify the potential swimming training centers which can be reached by every school child in the region. So that has to be mapped again, and maximum utilization of swimming facilities in the region should be done to educate children. And similarly, one of the problems is we don't have enough trainers and coaches. So therefore, we have to improve the training of coaches, as well as sometimes using volunteers has a problem sometimes, because volunteers may know the standard and they have to be guided, they have to be under supervision, they should be trained and then prepared for saving lives. And similarly, training the target communities, especially the fishing community and the boat riders and in the tourism industry. And the third one is the capacity building. That is where the managerial industry in the tourism, fisheries, and all that should take leadership in promoting skill development in their task forces. And the public rapid responders should be known, and especially disaster management center and various life-saving organizations which are involved in prevention of drowning. And the other thing is establish the safety points to locate rescue items in public water bodies, because then everyone knows where these rescue items are available. And these are the rescue items. You can go and see them. You can see the rescue board, and then this is the rescue ring and buoys, and this is called shepherd crook, which is used to take a drowning person from a swimming pool out. And this is a defibrillator. And unfortunately, defibrillators are not even available even in the hospitals or emergency departments sometimes, but defibrillator is one of the essential equipments, particularly in large swimming pools and particularly when there are sports events are taking place. So that you can save a drowned or near drowned person who has a cardiac arrest. And therefore, the CPR skills should be promoted among lifesavers and then coaches and volunteers. And in our group discussions, various departments got involved in that. The Ministry of Health took the coordinating, sorry about the spelling, they coordinated the events, and the Sri Lanka Police is immensely useful in injury prevention altogether, and even in implementing these guidelines in unsafe water bodies. And similarly, Sri Lanka Navy and the Coast Guard, and then of course Disaster Management Center, and particularly local government authorities, because these water bodies are located all over the country, and most of these places are supervised or owned by the local governments. So whatever the safety guidelines that are to be displayed, safety rules to be implemented, we need their help. So therefore we need to address them. And similarly, life-saving organizations have been helpful all the time, but you have to integrate them, and you have to get their support, and you have to support them to save lives. At the same time, Minister of Tourism, as I told you, has a great responsibility for, as the chair lady mentioned, we have about 2 million people visiting Sri Lanka. It's our responsibility to look after their safety. And similarly, there are hundreds and thousands of people involved in fisheries industry, and they should be guided to prevent accidents. And the Ministry of Sports can be used where they have resources and they have know-how how to train people to do swimming and life-saving. And therefore, all these stakeholders should get together and work as a big team to save entire community. And it is the responsibility of each individual, each citizen of the country, to take measures to prevent drowning and reduce the number of deaths, particularly in unintentional drowning, because that is something which can be completely prevented. Thank you very much.
Thank you very much, Dr. Mahanama, for the informative and very impressive speech on this event, Advancing Drowning Prevention for All, under the topic of Advancing Drowning Prevention of All. So, before inviting to the next speaker, I will take 2 minutes to tell you why Department of Fisheries is here in this event. As you know, fishing is a directly water-related activity. It's not a pleasure activity, but it's a livelihood. And drowning is a multi-sectoral issue. It's very common in fisheries sector. Fishing is a high-risk occupation. Drowning is the main cause of fatalities in the sector. So prevention is important, but when at sea or when in mid of the water body, we know if any distress happens, how to give first aids and all. So when we take the occasions where these incidents happens, at the sea, there are many incidents of colliding with ships, falling overboard, vessel capsize, and sometimes grounding, and distress due to weather. So as a department, we encourage people to, as a preventive measure, to take life jackets, lifeboats, and to we are responsible to communicate them the sudden weather changes. So in front of me, I can see the dialogue is displaying this Sairu communication. It's also one of DFAR and dialogue. Together we prepare the communication systems to the small scale fishers to inform, come back to the shore without facing to any hazardous situation. So Other than that, we are working with the Ministry of Health to train our people because 6 to 7 people go on board in high sea fisheries in boats. So we need to learn them how to take first aid, how to do first aid for a person who rescue from after drowning. And in the meantime, to prevent these things, now IMO and ILO, if you work with IMO and ILO to promote safety and decent conditions of fisheries. So by saying that, I would like to invite and introduce the next speaker to you all, Mr. Samit Tilina, Safeguard Training and Swift Response. The topic is Safeguard Training and Swift Response, focusing on professional lifeguard training, rescue operations, and swift emergency response to mitigate the impact drowning incidents. So I would like to give brief introduction of Mr. Samit Tilina. Mr. Samit Tilina is both the branding and marketing manager and examiner at Sri Lanka Life Savings. He has volunteering as a rescuer with Sri Lanka Life Saving since 2003. Samit is certified by the International Life Saving Federation as a lifesaver, major trauma first aider, and tactical emergency casualty care technician. He holds a Bachelor of Science degree in Sports Science from Sabaragamuwa University and a higher diploma in fashion designing from the Lanka Institute of Fashion Technology. So, Mr. Samit Tilina, you are invited to deliver your speak on this topic, lifeguard training and swift response.
Thank you very much. Very good morning, chairpersons, all the expertise, and the participants. So, it be a great honor to speak in front of you all, and it's really helped me for my presentation. To continue my speech, I will start from where the doctor stopped. So, lifeguard training and swift water emergency response are critical components because why we need to learn life saving, that's mainly where we are. What is the importance of this? As a Sri Lanka, as the doctor says, we surrounding a sea. We have 103 rivers, we have lakes, we have pools each and every province. But entire in this country, less than 20% of people can swim. Even that, just only 2,000 rescuers are certified now in Sri Lanka. Just only 2,000 rescuers. Because even you know how to swim, you can't rescue a person. So, once you come as an Sri Lanka, 750 more deaths each and every year. I'm not going to talk about the data because the doctor talked so many data about these things. So I'm come up with nearly 26% of drowning deaths happen in the lakes and the water reservoirs. Canals, if we take 22%, sea, if it is in 21%, and wells, 18%. So if you take more than 80% drowning deaths happen in inland. Just only 21% happen in the sea. So how we need to serve the people in inland? If you see, the rivers, lakes, canals are main reasons inside in Sri Lanka. As well as we are facing for 2 monsoon rains each and every year, with some of the flash floodings. So even the people are attend with the floods as well as the river. When it comes with the rains, suddenly the flash flows, the water flows are getting faster and heavier. But in Sri Lanka, the people have no idea how to survive when you're facing in this kind of situation. If you want to become a lifesaver, especially into the water reservoirs, if you want to save someone from water, definitely you need to learn it. If you think, okay, I can swim, okay, I can, if you see someone in water, okay, I want to jump to the water and take this person out from the water. Never. That's the biggest disaster. That's the hazard. Even you know how to swim, it's not saying you can save a life. Then you need to learn how to rescue a person. So where you need to come, you need to join with Sri Lanka Life Saving. Sri Lanka Life Saving, established in 1947 under the Australians. Still, we are trained under the Australian Life Saving Societies. And Sri Lanka Life Saving is the authorized body for International Life Saving Society and Commonwealth Drowning Society. So we are trained with Life Saving Victoria, RLNI United Kingdom, Utimate Japanese Life Saving, and the Asia Pacific Alliance for Disaster. So these are our technical supporting organizing. As an organization, we always think to create a safe environment to people in this country, as well as the people who come to this country. Because as a destination of tourists, Sri Lanka need to think about these drowning deaths and the rescuing. Because nearly 750 drowning deaths, from those 750, more than 20 to 30 people are foreigners. It's a disaster. And it's not good as a tourist destination. So, as a country, we believe always empowering people with the knowledge, empowering people with the skills. We can take a next step to rescue and to save the society. So we work with these government organizations. Throughout the past 74 years, we work with these organizations, and we have the international bodies as well as we have the local bodies, because all of these people want to save or to do something to this society, because each and every drowning deaths are preventable. If you walk in the road, if a bus or some vehicle come and hit on you, and if you die, you can't change it. But if you come into the water, it's your fault. You can save from the water. Each and every death can save in this country. If you want to become a lifesaver, so you have to come up with these certifications, because life-saving is not just a thing that you can learn and do, but you need to practice it each and every time, from water safety to become a surf rescuer. Then we have local certifications as well as we have the international certification. Each and every international certification have a guideline which is certified through the International Life Saving Society. So when you become a lifesaver, so you need a good physical fitness. If I ask each and every of you, how many days that you have a physical activity in your life in a week? Are you? How many of you do? Even that, how many you can swim? If I ask from this audience, I'm not asking to raise your hands, but ask from your heart. Can you swim? Can you run a bit faster, a few meters? So becoming a lifesaver, you need that physical fitness as well as you need that swimming ability. Even that, you need to know how to rescue a person. Just think, if you're going a deep water and if someone's grab you, then what you do? How you save without your hands? That's becoming a lifesaver's confidence. Always lifesaver need a mental fitness as well, because always your life is on 50-50. When you go for a rescue, your life is on a 50-50. Because you need to save your life as well as you need to save the victim's life. So it's 50-50 option. That 50-50 option always come up with your confidence. So you need to train your life. Each and every day you need to do physical activities, you need to swim, you need to practice your rescue methods, and you need to be a good mental strength. Always. As well as you need to know how to giving a CPR using an AED. If it is in a bleeding situation, how to manage a bleeding conditions. So you, as a lifesaver, you need to know each and you need to know the sea creatures, the water creatures, then how to act when it is in a sea creature situation. If you suddenly got affected with the jellyfish in the sea, then what you need to do. Same time, so mainly lifesavers are come up with this flat water as well as the surf. Then you need to know how to swim in a surf. It's not just a swim like a sea. It's totally different when it comes to the surf. High dampers, high waves, rip currents, then you need to know how to act in those things. Swimming skill is not just enough to swim in a sea. Then you know how to act in a high damper. High damper is because when we have the two monsoons, with the two monsoons, both side of the sea become the rough. At the rough season also, we have to do the rescues. Then you need to know how to use the equipments. I am please requesting each and everyone, once you finish, just if you get a time, come to that the lifesavers section and check all the equipments that what they are using and how to use. It will be really help, because world now is talking about the non-contact rescues. You need keeping anything, something with you, a flotation device before you get into the water. Even you are a good swimmer, even you are a good rescuer, you need something, a flotation device with you. Then you know how to handle that flotation device. It's so important, because always keep in your mind, your life is the most important. You need to save your life when you become a rescuer. Otherwise, it's no point when you go for a rescue, and if you died, then no point. There are past couple of years, there are so many incidents happen, the people who go to the rescue and died. It's no point. You become a hero and die, I don't think it's a worthless thing. You become a hero and you need to save your life, because you save someone's life and your family lose you, then I don't think it's in a no point. So as a lifesaver, then you need to know about the emergency response, how you act in the emergency response situation. Because if there is someone drowned, each and every lifesavers come and jump to the water, then no point. Because then each and every people in the beach or in the river or any place are in a risk. So all the lifesavers need to know, then you need to know who going to the rescue, who going for these things, who going for the first aid, who need to call to the ambulance, and who are taking each and every people out from the water. Those are calling as an emergency action plan. So you need to practice it each and every time. Otherwise, a disaster create the secondary disaster and become an hazard, and it become a worse situation. When it comes to the swift water, it's another situation, because Sri Lanka have so many rivers, and as well as if we have two flood situations, swift water is another main reason that we need to train and practice. If you see each and every time when it is in the flood situation, people using and doing so many unwanted activities. They're putting some logs and all, they trying to swim in the floods, they're trying to swim in the flood with that small tires and tubes and everything. So people taking risky actions when even in a flood situation. Sometimes there are so many rivers and waterfalls in nearest areas have giving a sudden flash water situations. But people have no idea what to do and they going those places, taking risk action. As doctor says, the consumption of alcohol is the third main reason in Sri Lanka due to the drownings. So once it comes to the swift water, each and every, even you are a rescuer, if you don't know how to use the equipments, if you don't have the proper equipments, you can't go for a swift water rescue. You need proper helmets, jackets. If you even that you need to know how to handling a rope. Even if I ask, can you knot a rope for a log, or can you put a knot to a tree? Can you? Then you can't do this. So even without knowing things, these are very hazards. So that's why always we need to teach people, come up with this. Those are life skills. When it comes to generally in Australia, people become an elderly, the swimming is a greater skill for them. But when it is in Sri Lanka, if you become an elderly, swimming is a dying ability. That's a hazard as a country. So when you become a swiftwater rescuer, you need to know how to handle the equipments, how to use personal protection equipment. Even you wearing a life jacket, that's no point if you don't know how to handle it. Using a rope in the water, knotting, how to handle a boat, how to using a paddling, each and everything. So I'm again asking, come to the section of the lifesavers and check each and everything, use that rubber boats and check and getting a small idea how to become a lifesaver. Then if we comes, mainly our knowledge come from the Australia, UK and Japan for swiftwater rescuing and the surf and the flat water rescues. So as an international lifesaver, so when we see the international training sectors, when we see the international trainings, we are in a very low level in the trainings. We can do all the trainings in the sea and the lakes and the pool, but when it comes to the swift water, we don't have a proper training location, because we can train in a natural position, we can training in a natural location. It's very expensive. You need a massive of the equipment. So I just want to share with you some of our trainings which we had in internationally. So this is in RLNI, Royal National Lifeboat Institutions, United Kingdom. They have a survival swimming pool. So this swimming pool can give the waves, thunderings, all the scenarios can create in a pool. So it's an amazing experience when you can have this kind of a survival pool. And this is swiftwater rescue training in US. So this is how a person swim in a swift water without any hazards, because they know this place is very safe place, and then people can learn a lot without getting a natural and real condition before they knowing how to handle with these water flows. Because when it comes with the swift water, you need to know how the water plays, where's the eddy, where's the most safest place that you can. Then you need to know how to swim against the current, against the water flow. It's a massive learning. So we need a regular trainings for each and everything. So we can do flat water trainings, pool trainings, and beach trainings each and every time. But it's quite hard to do regular trainings for a swift water in a natural position. So as a doctor says, we need, finally I come up with my endings as an, we need to create an standing operation procedure, as well as we need, as a country, we need open water disaster, open water drownings policy. Without this government involvement, it's quite hard to save the people in this country. So before ended up with my presentation, I just want to say prevention is better than curing. So be prepared before getting to the water. Thank you so much.
Thank you, Mr. Samitathilina, for the very explanatory speak on the life saving. I would like to invite next speaker, Dr. Tashi Tobge. I don't know whether I explained correctly. The topic is International Water Safety Initiatives, sharing successful drowning prevention initiatives and best practices from different regions and countries, fostering global collaboration. I would give a brief introduction on Dr. Toshi Tobge. Dr. Tashi Togbe is the Regional Advisor for Disability, Injury Prevention and Rehabilitation. He has been providing technical support to 11 member states of the WHO Southeast Asia region in the areas of disability, injury prevention, rehabilitation, road safety, drowning prevention, eye health, ear health, and assistive technology. He is a public health professional with vast experience in health systems, non-communicable diseases, communicable disease, and biotech. Prior to joining WHO in 2022, Dr. Tashi worked with the Royal Government of Bhutan in various health-related technical and leadership positions. So Dr. Tashi, I think he is joining virtually. So you are coordinating.
At the outset, I would like to thank the government of Sri Lanka, Ballroom office in Sri Lanka, and organizers of this conference for handling this important meeting, and also for inviting us to present on this important topic. I am Tashi Togge, working as the Regional Advisor for Disability, Injury Prevention and Rehabilitation, which includes road safety and drowning prevention as well. WHO CRO supports 11 member states, which includes Bangladesh, Bhutan, Democratic People's Republic of Korea, India, Indonesia, Maldives, Myanmar, Nepal, Sri Lanka, Thailand, and Timor-Leste. The outline of my presentation will be, first of all, I will present on the global and regional drowning perspectives, some examples where drowning prevention was successfully carried out, and some regional priorities for drowning prevention. Drowning is a preventable public health issue, and no one should suffer from drowning. Unfortunately, drowning could happen to anyone and anywhere. Drowning could happen from countries having large coastlines, such as Sri Lanka, to countries where there is no coastline. Most drowning happens in inland waters, and it can happen in a bucket, bathtub, pond, or pool. Almost all water is a risk for drowning, especially where young children are concerned. For example, in Bangladesh, the National Survey found that 50% of drowning among children aged under 5 years happened within 20 meters of the family home, mainly in ponds, followed by ditches and water containers. Globally, Drowning causes over 2.5 million preventable deaths in the past decade, with over 235,000 deaths annually. And this number has not even accounted the flood-related climatic events and water transport deaths. Disparity exists in drowning, with over 90% of drowning deaths occurs in low and middle income countries. This slide shows the global burden of drowning and risk factors for drowning. Drowning is one of the 10 leading causes of death in children and young aged 1 to 24 years old. Males are twice as likely to drown than females. The major risk factors for drowning includes bathing, collecting water, living near water, flooding disasters, travel over water, working on or around the water, and poor supervision of children. As highlighted in this graph, drowning is the leading cause of death in children aged 5 to 14 years, more than most communicable diseases like HIV or malaria. But drowning is nowhere near to this disease in terms of investments. Among the WHO regions, drowning deaths mostly occurs in the Western Pacific region, followed by the Southeast Asia region with over 70,000 deaths in 2019. This slide shows some of the key facts of drowning in WHO Southeast Asia region. Key highlights are males are 3 times more likely to be drowned than females. Almost all drowning occurs in young people. Older persons are also affected with 20% of death due to drowning occurring above 60 years of age. WHO conducted a regional status report in 2019. Among the Southeast Asia region, Timor-Leste, Thailand, and Nepal has the highest deaths per 100,000 population. The first global status report on drowning is currently being conducted and would provide an important data for drowning prevention. As highlighted in previous slides, this graph shows a higher number of deaths due to drowning in males and in younger age children. Drowning impacts on many sustainable development goals. Without addressing drowning, these sustainable goals would be impacted. Drowning is a neglected agenda. Investment evidences are there, and the reasons for focusing on drowning prevention is compelling. Just investment in 2 interventions, that is, providing daycare and teaching basic swimming skills, could avert around 770,000 fatal drowning cases and 993,000 non-fatal drowning cases. And in many countries, such as Bangladesh, has shown that even simple low-cost measures would be very effective. Drowning prevention requires multi-stakeholder engagement. It includes Ministry of Education, Health, Maritime, Disaster, and so on. It requires a whole of society and whole of a government approach to address drowning. Only drowning prevention can be implemented successfully. The figure lists the number of countries reporting involvement of specific sectors for drowning prevention in 2019 while we were collecting information for the regional status report. In 2021, United Nations resolution on drowning prevention called WHO to coordinate drowning prevention efforts. In 2023, World Health Assembly endorsed a resolution on drowning prevention. World Health Assembly resolution accelerating actions on global drowning prevention requires member states to assess their national drowning situations, develop and implement related programs, and ensure policy planning across a wide range of sectors to reduce drowning risk. This resolution further requests WHO to prepare a global strategy on prevention to better understand the true burden and impact of drowning worldwide. WHO has identified 4 broad strategies and 6 key evidence-based interventions that prevent drowning. Community-based supervised childcare for preschool children can also reduce drowning risks and has proven that this would benefit greatly in reducing the drowning deaths. Teaching school-age children basic swimming and water safety skills, as well as training bystanders in safe rescue, also reduces the risk of drowning and promotes safe use of water. These are some of the examples where drowning prevention are effectively implemented. In response to the high rates of child drowning, the Center of Injury Prevention and Research, Bangladesh, has established a village creches to look after preschool children during daytime and identified particular risks of drowning. By providing daycare for young children, their unsafe exposure to open water sources during this time is reduced. Caregivers, who are local women from the community, who are also taught on rescue and resuscitation skills to intervene if drowning incidents is to occur. In 2019, almost 9,000 children regularly attended this community-operated creches, which has been credited with significant reduction in drowning risks for children who attend these classes. As a result of this evidence generated, the drowning prevention program in Bangladesh is taken up by the government as part of the Comprehensive Child Protection Program, and the government has approved a national drowning prevention strategy as well. Because of all these evidence-based interventions, Bangladesh was one of the main countries supporting the recent World Health Assembly resolution on acceleration of drowning prevention. This is another example from Zanzibar. In Zanzibar, the Aquatic Survival Program provided children with key water safety messages and key swimming skills to reduce the risk of drowning. Young people were trained on basic swimming instructors and community educators to teach children on how to be safe in and around the water. The message is also taught in schools where over 1,000 school teachers have been trained to deliver the classroom basic water safety education. These two interventions have taught children how to identify dangers and keep themselves and others safe from water risk. Therefore, there are a lot of evidences that drowning prevention can be very effective in reducing the deaths. Southeast Asia region has developed key recommendations based on the findings of the regional status report. Some of these key messages in drowning are: drowning is a major killer, especially in young children. It is a neglected public health agenda. Government and international organizations need to do more in terms of drowning prevention and accelerate it. Still, drowning is one of the neglected public health agenda. Some of the recommendations are: one is to designate a lead agency or support establishment of a coordination body to drive drowning prevention efforts. To develop and implement a national water safety plan which contains national indicators for drowning prevention with clear indicators. We also need to formalize multi-sectoral mechanism to address drowning prevention and water safety. We need to document and share knowledge gained in drowning prevention across the region. We need to review the drowning prevention legislation to ensure that best practice laws are developed and that appropriate resources for implementation and enforcement are available. We also need to strengthen the data capture incidents and while strengthening the available reporting systems. Therefore, in conclusion, I would like to draw some key messages Drowning is a preventable public health issue. Most drowning occurs in children and youth at proximity of dwelling. WHO tools and best practices are available for countries to use. More actions is required if we are to reduce mortality and morbidity due to drowning. Lastly, these are some of the references and access to the WHO tools and materials. Once more, I would like to thank all the organizers for giving me this opportunity. And if you have any questions, please, you are most welcome to send me an email. Thank you.
Thank you, Dr. Tashi Togbe, for joining us and enlighten on us sharing successful drowning prevention practices from different regions. Now, this session, the three speakers, we complete the three speaks from the speakers, and now the floor is open for questions. So the floor is open for the to ask questions from Dr. Mahanama Gunasekara, Mr. Samita Tilina, and Dr. Tashi Togbe.
Good morning. I am Dr. Zulfik. I have been a motor racing champion for about 4 or 5 years. Now I would like to talk about the accidents, how to prevent accidents and safety of the lives. Now recently, about a week ago, I think last week or so, the holiday people who want to take their families, they go for holidays. Ultimately, what happened? They want to make the family happy, but it becomes a tragedy. You see, they go with their family. When they go, they are not concerned about the small infants, children. So recently, I saw in the media how the parents have gone out keeping the child, it was about 6 years or 5 years, in the room. And the child has come out and gone to the pool side. And to see when the parents went to find out what has happened when they were going for dinner, they found the child was missing. So they went in search. This happened in a hotel pool. So ultimately they found the child was drowned. You see what happens? So they had the children, especially the parents must be very, very careful when they go with their children. It is not the enjoyment. See what happened there, the child lost her life. So now I come to the second stage, that is about traffic. You know, so many cases I have seen, reckless driving or riding. I also have given special these talks to the bus drivers, the private bus drivers at the CTB. You know, they are not concerned about, first thing is they are not concerned about the passengers. They come, they keep their leg onto and there again, the other warning is, especially the drivers must be very careful about when they wear their sandals or whatever, they go with slippers. When it rains, when they wear the slippers, they keep their leg on the brake, accidentally it goes onto the accelerator. So that shows they are not very careful. So other thing is overtaking on the bend. So many deaths on the spot. I feel very sorry for especially the children. And they tried, some people like to race. I used to tell the drivers, if you really want to race, take part in motor racing on the track, not on show your colors on the road. It is not showing their colors. And they try to overtake. Ultimately, so many people die. Either that bus goes into the steep, and there are about 150, 200. Today I saw about so many deaths, about 12,000 deaths. So the only thing is they have to be very careful. So we should have more seminars with the police, with the accident service, nurses, and how the injuries have, it's very difficult to say when he goes for a very serious accident, either they go, their life is completely out for 10, 15 years, they go with a brain damage and no point living. So I would like the speakers also, and also to form a special committee, and so that we can have more safety and see that we save a lot of lives. Thank you very much.
Yeah, actually, what you highlight here is well taken to the consideration, and I invite any qualified or the speaker can respond what he raised on the social matters and negligibility of the parents on their children. So if someone can respond, it's better to give an answer.
I think Dr. Samita is the most suitable person to answer, but in his absence, I'll answer. All your points are well taken and they are really valid. As you said, we must continue this discussion. So, Dr. Ishad, ensure that we'll have a multi-stakeholder meeting in the presentations also. It's obvious that there is a lot of work we need to continue, so we will maintain our communication and we'll develop a good plan and also implement it. Thank you.
Yeah, in addition to that, we have strategies at our ministry also. There are 4 strategies. One is advocacy, health promotion and risk reduction, injury pre-hospital care, and finally the injury data management. By those things, we will discuss these matters with multi-sectoral coordination. We'll do further. Thank you very much.
Any other questions, please? On the 3 topics we have already discussed. Since there is no more questions, now this session is closed. So I invite the organizers to continue.
Thank you, Madam. And with that, it concludes the first session. And I cordially invite Mrs. K.V. Suranga Premani to present the token of appreciation to Dr. Mahanama Gunasekara. And then to present the token of appreciation to Mr. Samit Tilina, I respectfully invite Mrs. Kalyani Hevapatirana. Thank you very much. And finally, to present tokens of appreciation to our chairs, I respectfully invite Professor V. Anandaraman on stage. He will present to our chairs Mrs. K.V. Suranga Premani, and Mrs. Kalyani Hevapatirana. And with that group photo, the Symposium 3 comes to an end. Please enjoy the refreshments provided and join us in 15 minutes for more exciting and informative sessions. Thank you very much.
මල්ලි ඔයාලගේ ප්‍රසන්ටේෂන් දාන්නේ. ඔයාලගේ ප්‍රසන්ටේෂන් දාන්නේ නේද? ආ රයිට්. නෑ මම මේකට දාන්නම්. දැන් ඊළඟට පෝස්ට් ප්‍රසන්ටේෂන් එක තියෙන්නේ. ඒකේ පහක් තියෙනවා. ඒ ෆෝල්ඩර් එකේ එහෙමම මේ අයිනට දාන්න. මේ විනාඩි ගන්න. වෙනම කියනවා. Ayubowan, good morning everybody. Now we are going to start the fourth and the second series of free paper session. We have 5 free papers to be presented by our presenters and selected by the abstract committee. Now this is, we have 2 judges also. You will be, the presentation will be judged by 2 judges, and the results will be given at the end of today's last plenary session. And then some what's called then now the presentations, you can take only 8 minutes. The bell will be ringed in 6 minutes. Then you will be allowed to you can take only 2 minutes for the discussion. Then altogether 10 minutes for the presentation, again 8 minutes for the presentation, and 2 minutes for the discussion. And you will be notified, we are ringing a bell at 6 minutes time and 8 minutes, then you will be notified by I think 3 bells I think, then 2 minutes for discussion. That is the rules and regulations for this session. First presentation is on hit or struck by person versus object. Experience from Batticaloa district. This is, the authors are Darshani K, Sukunan G, Udayakumar E. Darshani K will be the presenter. Over to you.
Good morning, chairpersons, judges, and the audience. Very good morning. Yes, so sorry about that small delay. So our topic is hit or struck by a person versus object. This is an experience from Batticaloa district. An injury is an is any physiological damage to living tissue caused by immediate physical stress and can occur intentionally by a person or unintentionally by an object. Both can cause blunt or penetrating trauma. Injuries are #1 cause of hospitalization in Sri Lanka over the past few decades, and more than 1 million people are hospitalized each year with injuries. So injuries kill nearly 1,200 annually, and it's #1 cause of morbidity and mortality among economically productive age. So today's our analysis objective is to determine the proportion of injuries due to being hit or struck by the objects and by person, and also to describe the features of inpatient admissions with hit or struck by objects and by person. So the method, actually this is a desk review using the data that was available at the RDHS office retrospectively, and so these secondary data were extracted from injury surveillance form of sentinel site hospitals in Batticaloa district during a three-year period from 2020 to 2022. And we included all 5 sentinel hospitals. So Batticaloa district has 5 sentinel hospitals, 1 teaching hospital and 4 base hospitals. The total of OPD and inward patients admitted with injuries were taken and as the denominator, and the administrative approval was taken from the RDHS office. So the 3 years analysis of the major 6 injury causes in the district, the first one is animal bite, transport, and fall. So all these years, the focus in the Batticaloa district planning and implementation was focused on these 3. But the hit by the person and the object, even though it's in the first 6, it was neglected. So we thought all these 3 years, still it's in the among the first 6. So the deeper analysis would give us a more in-depth problems why this is happening in the district. So the results, the proportion of hit or struck by person for the years 2020, 2021 and 22 were respectively 11.6%, 10.9% and 11%. And the proportion for hit or struck by an object for the same year is 9, 6 and 7.6%. And the males were affected predominantly, and most prevalent age group ranges from 20 to 50 years by both types of injury. The number of deaths reported by hit or by the person is, for the person is 847, and for the object it is 143 in the same years. So the inpatient depth analysis, if you see, the struck of hit by an object, patients reported in inpatient, the numbers are increasing in 21 and 22. 20 maybe probably it's underreported due to COVID. So if you see the age for both types, it's the productive economically age, which the highest peak is in 2030 and 20 to 50 years, where the both types, it's showing the peak results. And if you see the body region, it slightly differs because the object is more in the limbs, and struck by a person is more in the head region. And if you see the affected body region, and then the place of struck or hit by the person is nearly 72% is at home. And also the object of hitting also nearly 7% is occurring at the home level. And the evidence of alcohol, we expected the yes to be more, but it shows the data nearly above 95%, the results came as no, according to the surveillance forms. So the conclusion, hit by a person is more prevalent than hit by an object in Batticaloa district. Head is mostly affected in hit by person, and limbs are more affected in hit by object. And both types of injuries occurred mostly in their houses. So based on this, we recommended because this is a desk review, so we need further studies to determine the causes and the associated factors with these two injury forms. And also, because the more by the person is more, that is intention injury is more, so the mental well-being promoting programs to the public, and also the place of the injury is more in home. So in the district, we would recommend home should be a more safer place, and the government has, NCD unit has introduced a home safety checklist. So that should be monitored throughout the district. So the limitation in this desk review, because only the sentinel site hospitals were selected, and there were some incomplete forms, and due to COVID-19, 2020 and 2021 data may be underreported. Thank you.
Thank you. Thank you very much for finishing or limiting your presentation for less than 8 minutes. And it's a very interesting topic, and you have selected a very good area for your study. And this, the floor is open for questions. Any questions? Yes. First, from judges, yes.
Yeah, I have a question. How do, in this research work, how do you define the object? And how do you define the hit and stuck?
Madam, these data were extracted from the forms given to the hospitals by the NCD unit. So there, the objects were defined in, only the nursing officer has to tick which object.
Can you explain the range of objects that may have fallen into this group?
Yeah, because this is retrospectively collected data, madam. So, so on admission, so these forms were filled. It was, I didn't go and take it because it's all this data was collected in the unit, and from that only we extracted. So in the form there's a column to be ticked whether it is by the object or by the person, so that the standard format is there.
Okay.
What is your denominator and how did you assess it?
Yeah. The denominator is for the proportion we took was the total of OPD and the inpatient admissions.
Did you assess the quality of your
quality of the
forms? And did you quantify the quality of your filled forms?
That's the thing, madam. I said limitation. There were several not fully filled forms. So we discarded that and only took the forms that were fully filled.
What is the percentage like?
Yeah, out of these 3 districts,
Madam, you want to ask?
Actually, I want to make an observation that it's very good you are using the injury surveillance forms. That's what we wanted, not to transmit it to the center, but at your level also to use it. But a very important point was brought by the judges. You must be very clear, have a very clear understanding of what's meant by each, and also to ensure the quality of the data. I hope in the future you will ensure that it's also
madam. So
mentioned.
that's why I put it in the limitation, and the recommendation, we said that we should study more, because this is retrospectively collected data, so we should do research on this to find out the actual situation, because this is the data that we have. So why these continuously, these two injury forms are more common in Batticaloa district is our main thing. So we wanted to highlight that, and then in future to do a research on these aspects, because all this year the importance were given only for the animal bite, road traffic accident and the falls. But these two, it's continuously is high and it's rising up. So that's what the thing that I wanted to disseminate to this group.
And one observation, and now in the injury surveillance form, according to my knowledge, that you can further analyze that one according to the intention. If you could show the intention, correlate the struck or hit by a person and the object according to the intention, whether it is unintentional or intentional, or it's not deliberate self-harm, that will give us more information about the cause actually. Then, yes, that's the one observation. Thanks.
We will do. Thank you.
Okay, thank you very much. If there is no question, shall we move on to the next one? Madam?
Our next presentation is on Safe Communities Initiative for Injury Prevention at Community Level in Gampaha District. Authors are Vaninayaka WMIK, Gunaratna KS, Fernando WTSP, and Jailat is, although Vaninayaka is marked as the presenter, I think Gunaratna KS will be making the presentation.
Good morning, everybody. Today I am going to present this SAFE committee program in Gampaha district. Before introduction, I like to say thank you to Dr. Samita Siritunga, Consultant Committee Physician, to push me to do this forum. And again, I like to say thank you for our previous district secretary who always behind me to implement this program in Gampaha district, Mr. Sunil Jailat. Injury prevention, introduction. Injury prevention is multifactorial, involve multiple sectors and coordinated efforts. Multifactorial, multiple sector involvement and coordinated effort. Community empowerment and participation are crucial. The SAFE Committee program is a commendable initiative addressing many health issues, including injuries at the community level. Here, we implement SAFE Committee program to reduce injuries, not only injuries, to reduce common NCD risk factors at the grassroots level, not only that, to uplift the health, physical, mental, social, spiritual well-being of people living in our district. We started this saying, Boho janayage hita suwa pinisa, Boho janayage suwaya pinisa. Method. This started in 2015. We implemented district and divisional steering committees comprised of health and non-health personnel, that is regional director of health services and district secretary. With both parties, we started this. Selected a specific Gramanilidari division within an MOH division. And in 2016, we started with 15 SAFE committees. Then next year, another 15, next year, another 15. Finally, altogether, 45 SAFE committees. At the village level, a dedicated team was formed to implement the program. Consists of divisional secretary team, that is Grama Niladhari, Samurdhi Niladhari, various development officers, agriculture officers, and from our side, health side, MOH, public health midwife, public PHI, and our people, health people. Then conducted a baseline survey to identify and prioritize health issues. Activities included not only injury prevention, promoting home safety, environmental protection, and addressing health concerns such as chronic NCDs, vector-borne diseases, cancer, environmental pollution, and substance use, and many more. This is the district steering committee, consists of directorate, NCD, and cancer control unit, health promotion bureau, young elderly and disabled unit from health sector, and district secretary, divisional secretaries, all divisional secretaries, and all other officials from Regional Director of Health Services Office. This is District Steering Committee. And then divisional steering committees consist of divisional secretaries and all other health and non-health officers. Then did a baseline survey and started the work. Results. At the end of 2015, there were no safe communities in Gampaha district. End of 2019, we had 45 safe communities in Gampaha district. Home and environmental safety improved, injuries reduced. Community members gained knowledge on safety issues, with most households having first aid kits. At the beginning, no first aid kits in those homes, and finally, everybody made first aid kits. Healthy behaviors like increased gardening, reduced salt and sugar, and fat composition were observed. Physical activity and behavior modification programs improved. Environmental pollution decreased, enhanced social relationships, and encouraged spiritual engagement. Tobacco, alcohol, and illicit drugs are declined. Here you can see some pictures, gardening, promoting home safety, and Sinikurulla. This is a traffic light system really, started in 2019. This is from Jayala MOH area. They creatively reduced sugar and salt with this Sinikurulla, and addressing vector-borne diseases, physical activity, spiritual engagement, many more, not only injury prevention. Conclusion and recommendation. Multi-sectoral engagement and community empowerment can significantly impact attitudes and behaviors for injury prevention and health promotion. This initiative of addressing health issue is cost-effective. We didn't use money for this program and could be recommended for nationwide implementation. Thank you. I say again, unity is the strength.
Yeah. Thank you, Dr. Gunratna. You have done a lot of commendable work. I just want to know, we have developed a home safety checklist.
Yes, ma'am.
Are you using that in these safe communities? One
Yes.
question. Other one is, we have the first aid kit, but, have you trained the household members on first aid and, what are the actions to be taken and all those things?
Yes, madam. Home safety checklist we used in all safe communities. Our public health midwives, they trained all mothers in other groups, school children, these people who were in these safety villages, they trained them very well. And we went for each and every house to see this program. We saw those people very well knew about these home things within this home safety checklist. They use that really. And madam, you can see in our stall there, they are exhibiting those home safety checklists and what they are doing in those safe villages. And second question you asked about first aid kits. They were using very nicely in those homes. Really, several times we visited, supervised, and from ministry also supervised. They are thoroughly knowing how to use those kits. Really, they are using all these things in grassroots level. We have to appreciate our health and unhealth staff for doing these things. Not us. They did, not us.
For the judges, you can ask.
Actually, I congratulate on this nice presentation, and it's a really commendable initiative. As for our verification, I have one main question, the term safe community. Because do you have a specific definition for that? Because since you have said in 2015 there are 0 safe communities in the area, probably as you said, there had been a lot of aspects that you considered to define a safe community. Did you have a kind of a scoring criteria to define a safe community? Or how do you say that you did not have a safe community within the whole district?
Yes, madam. Safe community in Sinhala, we use the word Surakshitapura. It came from the ministry as a guideline from NCD Directorate. We got this idea in 2016. This came really to prevent injuries. This is an injury program. But as a holistic approach, we started with all the other NCD factors to reduce NCD risk factors. We started with injury prevention and many more items we added to this safe community program. Selected the area from our divisional secretaries and MOHs both got together and they selected the area. Sometimes it may be 25 houses or more than that, or a street or some area. They selected the place as their agreement. The officers should be available for all these sectors, no, health and unhealth. So they selection criteria was vary for various MOHs. And our district secretary wanted to join all officers together and to implement various things in that community. It's safe community guidelines also that was given by ministry, agreed with that guideline. So we did various things in this safe community. So, Surakshitapura. No, madam, you got the...
What I mean is, it's okay.
Can I also explain? Yes, Oma. I think Dr. Samita will explain.
Actually, now in case of safe community, we have given some directions from the NCD unit to create some safe communities within the area, addressing safety from injuries and other non-communicable diseases. We have not yet identified some indicators, as you said, indicators to evaluate the program. and we allowed these the areas to identify their own problems by doing, I think she mentioned about doing a survey and something like, and through the survey to identify the problems and address all these problems according to their level. That is, yes.
Thank you.
You want to ask anything? Okay, then thank you.
Thank you, madam.
Thank you, Dr. Shi.
Thank you, sir.
Thank you very much. The next presentation will be on Swim for Safety, Sri Lanka, Survival, Swimming and Water Safety Education among School Children. The authors are Nanayakara A, Vikramasinghe T, Jeevantha S and Thilina S. The presenter is Thilina S. Over to you.
Before start the presentation, I just want to ask from you, did you check your place before you come to the here? Did you drain all the water buckets? Did you drain your wash basins? Did you drain your bathtubs? Did you close your bathroom? If not, just take 15 seconds from my time and give a call, check whether your child are safe at your place. Please do it before I start my lecture. Please. I will give 15 seconds before. This is Sri Lanka. This is where we are. So, Swim for Safety, Sri Lanka, survival swimming and water safety education among Sri Lanka school children. I am Samit Tilna, representing Sri Lanka Life Saving. Very good morning, all of you. As we know, Sri Lanka is the 15th country from all around the world with these drowning deaths. Nearly 750 people died each and every year. From these 750, nearly 100 kids are drowning between ages of the age 1 to 14 each and every year in Sri Lanka. So it is a hazard, as well as once we come with the WHO says, each and every child who near the water is a hazard. So we, as an organization, taking 3 primary things why these school children facing for this situation, why this much of drownings, much more in Sri Lanka, mainly lack of water safety knowledge, lack of using of safety equipments, not aware of safe places. From this practice, what we need and what we aiming is to give a survival ability to each and every kid. This is not talking about the competing. This is all about survive your life. If you are a survive, or if you are trained for survive in kids age, then you try to practice each, and once you become an elder, even that you try to do it, practice, because perfect practice make perfect always. And we trying to reduce all the drowning deaths in Sri Lanka through the empower the kids. This is the method of this training was come up with 12 sessions. Within these 12 sessions, we have 10 learning sessions and pre and post examine 2 sessions. Each and every session have 1.5 hours, and 25 students only we taking for a 1 class. All the students are in age 10 to 16, and this is fully trained as program from Australia. The Life Saving Victoria is the resource for this training program, and each and every session, it means each and every 12 session completed, they have a post test as well. Currently, we are running 5 locations in Sri Lanka. From the top, Kilinochchi, Vennapuva, Bentota, Ambilipitiya and Matara. Those are the currently training locations for Swim for Safety program running in Sri Lanka. In this training, we try to empower kids in two ways. One is skills. They need to know how to get into water, how to get out from the water, moving through water, swim underwater, floating, sculling, rotation. Rotating means if you fall into the water face down, within 3 seconds they can survive by take their face upwards within 3 seconds. And swimming, this is not training a competition swimming. This is all about survival. How to survive their self from a water. That's all. This is not about competing. And from the knowledge wise, we trying to empower their knowledge on basic water safety knowledge, recognizing and identifying hazards, then safe rescue methods. So mainly we trying to teach them talk rescue, throw rescue and reach rescue. That's all. These are mainly non-contact rescues. You no need to get into water to rescue someone from these methods. You can talk to someone, you can throw whatever you have, a flotation device to someone, you can put anything, a log or leaf, whatever you can throw to someone and you can pull the person, you can reach the person. So you no need to get into the water. And you need to, finally we try to teach them or empower them with the DRSA, that's the basic primary things, need to identify the danger, then checking the response of the patient and call for the ambulance, open the airway, those kind of primary things that we trying to teach them within these 12 sessions. We run up the program starting on 2016. Actually, we never thought to do a research-based program. So we run up the program. After 1 year time, we collect few data and we try to see how our progress was. So it was nearly 1,000 kids joined with us. From 1,000 kids, nearly 768 kids were completed, come up with the 12 sessions, because it's must to joining 100% attendance to complete a session. But currently, from 2016 to right now, more than 5,000 kids were trained with us. So this is their skill level and how their skill level were improved. And this is the recommendations what we can do for the further. We need a good locations. We need, if we can come up with that cost-effective locations, even that when we're using a pool, it is really costly for a program. But that's why if you see most of the pictures are come up with the rivers and the lakes in Sri Lanka, we're using all of these locations because it's cost effective. But we are thinking if the schools can come up with this program, or if the education ministry or the sports ministry who can come up with this kind of a survival programs, yes, we can do much more things to the society. My conclusion is, if we empower the kids, with the survivals, definitely they will survive. Otherwise, if we losing a kid, it means the country losing the humans. Then no one, keep in your mind, there are no 50-50 options in drownings. Because if you hit an accident, if you come up with a road accident, yes, you can remove your limb, you can lose your limb, but you live. But there are no 50-50 options in drownings. If you drown, yes, you have two options. Either you survive, either you die. That's all. So that's why we are thinking about the Swim for Safety program is, right now it is within the 76.3 of accuracy. With this program, we trying to encourage this program to all out the Sri Lanka. So this is my references, and Thank you very much.
Thank you very much, Stilina. Now the forum is open for the question and answer session. First from judges.
That's a nice presentation and good intervention. Congratulations. Can I know the ethical and administrative clearance process of implementing this program?
Basically, the difficulties of this program, is that what you ask? Difficulties?
How did you obtain ethical and administrative clearance for conduction of this?
So mainly Sri Lanka Life Saving is running with the program. We are taking some fund. We have some funding programs from internationally. For those funds, we need to divide into our training locations because we need some safety equipments. We need to train the teachers as well as we need to take the lifeguards as well. Because once we are running the program, always for the 25 kids, we need to keep 2 teachers and 1 lifeguard with the equipment. So for the administrative part as well, with the Sri Lanka Life Saving, have to think more because it's quite expensive with this program, and the administrative, we dividing all these 5 locations, and we are supporting as an organization to those 5 locations to run the programs. Each and every location, we have our instructors also who have the train under the Australia training. That's how we running the program currently. That's our administrative part of that program.
Thank you. But as to me, it seems that a lot of school children now get involved
Yes.
here. So when we get school children involved, there should be a ethical and administrative clearance to get them involved.
Yes.
So I wanted to know how you have obtained.
So normally what we doing is we are writing at the program to the education ministry, and each and every regional, I think zonal education systems are supporting to the program. They provide, once we give in the letters to the zonal education centers, government organized authorities, they send those letters to the nearest schools, and the schools are giving kids to the program. It's quite hard to collect the kids. That's also another program. Some of the provinces are stopped the program because schools are not allowing sending kids to the program because of this, some of the protocols in this system. But some students are coming privately, but most are we are going with the education, zonal education systems to take the kids from the schools. If the program is running with the school name, yes, obviously we are come up with the zonal education system, government authorized bodies, and we take in the kids throughout that. That's the process of it.
So I congratulate you to your initiative. I just want to ask you, because in your presentation you mentioned about a success rate.
Success rate?
Yes.
Yes.
Could you please elaborate, how did you assess that?
So once we take in the kids for the program, very first day we giving a small test for them. We asking them, do they know what is the DRSAB? Do they know what to do before, if you see someone get into the water, what you try to do? Then we trying to take their skill level. We ask, they put into the water, and we asking, okay, you swim as much as you can, or try to float in the water. That's our pre-test. Same thing, we have written as well as skill test, that's pre-test. And once we finish the 12 session, we taking another post-test with the same questions and the same physical skill test. Then that's how we collecting the data. Throughout that, we taking the success rate for kids. That's how we taking it.
So what is your opinion on the sustainability of the program that you said you have came across very much of challenges? So how do you overcome and make the program sustainable?
Yes, that's another problem as a country, because within the 12 session program, they've shown us their accuracy. But once it comes to the sustainability, kids have problems to continue their swimming trainings, to continue their skills. There are problems, to be honest. They can't go to the swimming pools, they can't take a coach or swimming coach and continue these sessions. There are few problems. That's the main reason. But some of the kids who are engaging with our coaches, they are continuing their swimming ability to sustain. But the sustainability have to, again, we have to consider as an organization also, we are fight with that sustainability progress to take up more sustainable through this program, because we don't want to lose kids after age of 16. We don't want to lose those kids. We need to keep them again and again with much more practicing with us. But we also have some struggling to keep the kids in this sustainable process.
Okay, thank you very much. Okay, thank you very much.
Our next presentation is on non-fatal drowning in Sri Lanka. Authors are Jiwanti S. and Bandara D. Bandara will make the presentation.
Good morning. As you well know, drowning is the second highest cause of accidental death in Sri Lanka, and this comes right after road accidents. On average, around 3.5 deaths per 100,000 population is due to drowning. So as Sri Lanka Life Saving, as the national body for water safety and life saving, our main goal is to reduce and prevent drowning throughout the country. The non-fatal research study was first initiated to collect the data from the communities throughout Sri Lanka to help us understand the exact effects of the services that we conduct and how it could be further developed. So we have two main objectives through this survey. That is, one, to recognize the knowledge of fatalities due to drowning, and to also highlight the importance of water safety and its impact on survival. This research study was conducted through an interview-administered questionnaire, which consists of basically 12 questions. So the target populations were Sri Lankans within the ages of 18 to 70 years old. So we had international volunteers come down to us, and in total there were 18 volunteers so far. So every 6 weeks, 2 volunteers maximum would come about and support us in getting the information and for collecting data and for analyzing these data. The participants were usually targeted through the water safety programs that we conducted, and also we also gave the opportunity for the volunteers to give out the surveys to any Sri Lankans that they would meet or who are willing to do the survey, and those data were also collected. In total, we had 1,424 surveys collected, and out of these 1,424, 1,139, or rather 80% of the participants recorded that they knew someone who had experienced drowning or they themselves had experienced drowning. And 20% of these participants showed that they did not know anyone who has drowned or has not experienced drowning. When the survey was administered, most of the participants, they were very interested in getting to know about water safety and drowning prevention. And so we usually do our water safety programs go on for about 3 to 4 hours, and they would occasionally request us to take part in these programs to get a good knowledge on the water safety and drowning prevention that we conduct. So this is an example of the research survey that we conduct. So like I said, 12 questions in total, and this was based in English, Sinhala, and Tamil to target the diversity of cultures in Sri Lanka. And some of the main questions that we asked were the age of the victims, the locations. So locations would usually include beaches, pools, lakes, anything of that sort, and even the provinces like Western, Sabaragama, and so on. And we also asked them who saved the victim from the accident, or if they were the people who drowned, then who saved them from the accident, and also the equipment that was used for the purpose of the rescue. So this is just a demographic of how, like I said before, 1,139 were people who has experienced drowning and who knew people who had experienced drowning, whereas the rest of the 20% had not. Most of the male population showed that they had more experience in these kind of drowning incidents, whereas the female population did not. And we also found that the beaches were the most frequent places for drowning incidents to be recorded in, and the Western province was more prone to drowning because of the population. In conclusion, this survey helped us conduct our water safety training programs and to expand our water safety programs. And also it was kind of an eye-opener so that the relevant authorities or the government could take proper action in minimizing the incidence of drowning throughout the country. We also found that more than deploying lifeguards to locations that are more frequent in drowning, we found that water safety education, spreading that knowledge to the communities throughout Sri Lanka was more efficient, and it showed more impact on how it could expand the knowledge. And also, water bottles and school bags could also be used, because I think most people would think that having heavy equipment would help them, but honestly, just water bottles, branches, tree branches, they would help a lot in saving a person and minimizing that incident. As we like to say, drowning does not target a specific location or specific people, but it is a silent but deadly killer, and it affects the entire globe. As for the recommendations of this research, like I mentioned before, as one of our main objectives being the prevention of drowning and the reduction of drowning and the spread of water safety, we believe that three most important or key recommendations, such as educating the communities through Sri Lanka on the importance of water safety and basic swimming skills, is much needed, and raising awareness of first aid and CPR knowledge starting at the grassroots level is also very important. And the use of community lifesavers, emergency disaster response teams to overcome and support the communities of Sri Lanka was significant in the reduction of drowning. These are some of the references that I used throughout, and thank you.
Okay, thank you. Judges, you have any questions?
Data collectors are actually, that's an exam presentation. I have few clarifications. Are the data, which language they ask the questions for data collection? Yeah. It is mentioned that volunteers, they are foreign, right?
International volunteers, yes.
Yeah. So which language did they use to ask this question?
So the survey was, like mentioned, it's in the three languages, Sinhala, English, and Tamil, but when they do give when they administer the survey, they usually talk in English, in English. But then if we do encounter like a population that is not very fluent in English, then some of our volunteers would go with them to help them with the language barrier.
Okay. And also the most of the participants has been volunteers?
Yes.
Volunteers and convenient kind of sampling probably?
No, the participants were Sri Lankan, like it could be school children, the Sri Lankan communities, but the volunteers, the international volunteers were the individuals who administered the survey.
Okay, so based on those two facts, to which extent do you think that this is representative for Sri Lanka? The findings, the representativeness of these findings and the validity of these findings to Sri Lanka. What is your inference on that?
So this survey was, like as mentioned, it was initially initiated to sort of figure out on how much of the population is aware of water safety and drowning prevention, and how much of the population has experienced drowning, and how to minimize that. So we are planning on keep going on with this research so that in the future we could use this, we are using this data right now, so we could improve on our programs, on our water safety programs that we conduct right now. We can target certain locations, especially the rural areas. So we're hoping that this would minimize the impacts of drowning and could expand the water safety knowledge. Thank you.
Yes, please, sir. Can ask.
Yeah, in your conclusion, you have mentioned that tree branches, ropes and bottles will be save the life. Is it a research finding or assumption? So is it included in your question?
Yes. So Mr. Samit, he was presenting before, he was talking about the Swim for Safety program. This was a survival training program that we teach children, school children, how to use water bottles and how to use school bags to sort of stay afloat in water. So this was definitely something that we experienced on our own, and Mr. Samit, maybe you could give a better response on this.
As a country in Sri Lanka, we are practicing that concept called Utimate. Utimate is a concept from Japan. They are teach how to save a person with anything, whatever you have right now. Anything, water bottle, a bag, shoes, slippers, whatever you have, any kind of a flotation device, whatever you had, how to use it for a survive someone. So if as a country, we don't have much more safety equipments, a proper safety equipment. So if you have a water bottle, if you have a 1 liter of a mega bottle, yes, you can save a life. So if you have 1 or 2 mega bottles put into your bag, if you can put inside in front of you, yes, you can save a life. If you can remember, a couple of years ago, there are 7 kids died in Kenya by a watercraft capsizing. At that point also, if they are knowing how to save their life with their water bottle, their bag, definitely we believe they can survive their life. So that's why we practice in these kind of aspects to save the life within whatever you have, any kind of things, water bottle or whatever the flotation device with you. That's what we practice. Thank you very much.
I think what he wanted to know was that a finding of your research, or it's your knowledge, when you give the recommendation, did your research find that? Did the people know about it?
Mr. Samit, maybe you could respond to that better, because this was part of our program.
To be honest, first we want to know people have any idea about what is drowning, because people don't know what is drowning. They think, okay, someone is in water, struggle, and if someone is come and help them, they think, okay, it's okay, done, nothing was happened. So first we need to give an idea to people, okay, there are some drownings. So first we need to get some knowledge from the society. Do they know really what is drowning? So that's why we try to this, taking this non-fatal incidents, even they know their surrounding have some risk, if there are some hazards, because people believe, I am live near the river, I am so familiar with the river and I can do anything with the river. That's the problem. People are more overconfident with water. Sometimes that's another problem. That's why we want to get a more knowledge from these fatal things, and we want to get an idea. Do they know much more? Know about what is the drowning? If something has happened, what to do? Before that, they know what is the really drowning was. That's why. Because we have some incidents also, even a drowning was happened, people not caring to take to the people to the hospital even. And the secondary drowning was happened after 2-3 days, they were died because of the secondary drowning incidents. So that's why. That's, I think the answer will be enough.
Okay, thank you very much. And we'll move on to the last presentation as we are running short of time, behind the time now. Can school teachers be lifesavers? Knowledge, attitudes and practices of school children, teachers regarding school injury prevention, basic life support, first aid and care for the injured victims in Vahare Medical Officer of Health area in Batticaloa district. Authors are Patirana LPIU, Shachinta HMT. The speaker is Patirana LPIU. Over to you.
Good afternoon, ladies and gentlemen. My topic for the presentation is, can school teachers be lifesavers? Knowledge, attitude and practice of school teachers regarding school injury prevention, basic life support and first aid in Vaharai Medical Officer of Health area, Batticaloa district. Background, school teachers are the first responders to majority of school injuries, and according to UNICEF, unintentional injuries such as road traffic accident, drowning and poisoning, falls, burns, these 5 categories make up about 60% of deaths of adolescents worldwide. And globally, more than 1,600 children and adolescents will die every day from preventable injuries. So early interventions can significantly reduce the mortality and morbidity due to school injuries. Prevalence of serious unintentional injuries among school-going adolescents have been identified as a major public health problem in Sri Lanka. According to 2016 Global School-Based Health Survey, these kind of injuries were found to be more common in males and also common in 2 age groups, 13 to 15 and 16 to 17. And as children are a vulnerable group and they spend substantial amount of time at school, they have the chance of being exposed to various hazards at the school ground. And school teachers as the first responders have to have some knowledge regarding first aid. So multi-sectorial strategic action plan on injury prevention and management Sri Lanka has included school injury prevention as part of that. And the objective of the study was, it's a cross-sectional descriptive study to investigate the knowledge, attitude and practices of primary and secondary school teachers of Vaharai area, and regarding basic life support and first aid and school injury prevention. And the study aims to provide insight for the development of training programs and future educational initiatives and policy recommendations to improve the competency and readiness of school teachers in providing first aid and basic life support. So the method, the study was designed as a descriptive cross-sectional study and included school teachers residing in Vaharai MOH area, and a structured, pre-tested, self-administered questionnaire was used to collect the data. Simple random sampling technique was employed, and teachers from 13 schools from both primary and secondary classes were selected, and total 151 participants were there. The questionnaire contained 45 questions, and there were 13 questions regarding socio-demographic data and 8 questions regarding knowledge, and 12 attitude-related questions and 12 practice-related questions. Ethical aspects, the anonymity of the participants were kept, and permission was obtained from the zonal education office of the relevant area. Informed consent was obtained from all the participants. So the results, so we have collected data from 151 participants, and socio-demographic data-wise, majority of the participants were less than 35 years of age, and majority of participants were females, and only around 8.5% were physical education teachers. And teaching experience-wise, most of them had less than 5 years of teaching experience. So we'll move to the knowledge part. The knowledge of the teachers, the primary source of first aid knowledge was regarded as education books for about 51% of the participants, and about 28 of the teachers had prior first aid training. From that, around 70.7 had received in-person training. But a mere 27.6 demonstrate knowledge on how to place a child in the recovery position. So there's a gap in their basic first aid awareness. And also there was 46.3 who held a misconception about seizures being limited to certain family backgrounds. And 41.5% of the participants could identify tonic-clonic movements as a sign of seizure, but other signs were only recognized by 20 to 30% of the participants. And from the teachers, only around 18.6 were aware of their school children and their classes who has a history of seizures. Regarding the attitude of school teachers, 89.9 teachers who had received training felt confident in giving first aid, and around 47.6 assumed that first aid should be started only by a first aid trained person, and around 51.7 felt first aid can be started by any person if no trained person is available. From 19.5 felt first aid training as important, and around 82.6 were willing to attend a training program. So we asked about the preference of the training program, and 56.3 preferred school-based small group teaching, in-person teaching program, and 13.23 opted for district-wide teacher training, and 11.3 recommended online training of the first aid and basic life support. Regarding the practices of school teachers, so 68.5 rightly prioritize moving a child to a safe area before initiating basic life support, and 44.1 recognize the need of observing a child who has become unconscious following a school injury, and around 32.2 routinely bring first aid, but around 18% only had access to eyes for soft tissue injuries. And 35.6 correctly practice cooling the burn with running water, but there was 23.7 who incorrectly practice applying toothpaste. And 53% has the incorrect practice of providing a metal spoon to hold during a seizure attack, and only 14.4 correctly recognize the importance of turning the child during a seizure management. And 15.9 incorrectly suggested attempting to open a child's mouth during a seizure. Conclusion, our research highlighted gaps in knowledge and practice regarding first aid, basic life support, and basic management of seizure and burn injury. Mean value of knowledge was around 0.3 in a range of 0 to 1, and around 58% had poor knowledge, and about 40% had moderate knowledge. General good attitude and confidence and willingness to administer first aid during school injuries was identified, and there was a significant positive correlation between good attitude and good practices. Generally, teachers who had good attitudes regarding the first aid and basic life support were had more
more implementation of good practices to their everyday practice. So enthusiasm and willingness to attend future training programs to bridge the efficiencies was identified. So these findings can guide a future large-scale research and design of a tailored program. So recommendations, standardization of current training programs for school teachers like as planned in the multi-sectorial plan, and encouraging regular practice to maintain and update the first aid skills, and incorporating first aid into the school curriculum and developing a mechanism of training for children also. Some of these recommendations were given by the school teachers themselves. These are the references.
Okay, thank you very much for your interesting presentation and interesting research. The forum is open for discussion. First from our judges. Anything you want to ask? Okay. Yes. Madam? Yes. Yes, Professor Upul.
I think well-conducted study. I have a small clarification. Now, when when you ask about the practices, did you relate it into an experienced event or just the practices that they would do in such a situation? Because that is very important to decide, because if there's a practice which has already done or practice that they would do in case of an event.
These are the practices that they would be doing if that kind of a situation arises.
Right, so that may not really reflect the actual practice, right? Right.
Yes,
okay. That's a limitation. Thank you.
Okay. There is no other questions. Okay, thank you very much for your excellent presentation. That concludes the last session of free paper session. Over to our...
Thank you, Chairpersons. So I would like to invite Dr. Champika Vikramasinghe and Dr. Samita Singh Iltunga to award certificates to the presenters of research papers. Darshini K. Sheelani Gunaratna. Samit Tilina. Devasti Bandara. LPIU Patirana. Thank you, Madam and Sir. Thank you, Madam and Sir. So I cordially invite Dr. Ivan Shua to present tokens of appreciation to the judges of this session. Dr. Niranjala Mudalige and Dr. Yasoma Vijayasekara. Thank you, Dr. Ivan. I would like to invite Professor Samat Dharmaratne to present tokens of appreciation to our chairpersons, Dr. Champika Vikramasinghe and Dr. Samita Siritunga. So I would like to invite our speakers of this research paper presentation, our chairpersons, the judges, and the presenters for a group photograph. So we would go ahead and start with the next session, a plenary on community engagement, social marketing and public-private partnership in injury prevention. The theme of this plenary is Beyond Awareness, leveraging community engagement, social marketing and partnerships for effective injury prevention. For this plenary, I would like to invite our chairpersons, Dr. Lakshmi Somatunga, Additional Secretary, Public Health Services of the Ministry of Health, and Professor Upul Senarath, Professor of Community Medicine, Department of Community Medicine, Faculty of Medicine, University of Colombo. Over to you, chairpersons.
Good afternoon. It's really pleased to be here because although now Additional Secretary Public Health Services, I started my medical administration career as the Director Non-Communicable Diseases in 2001. During that time, I was able to start this National Injury Prevention Program of the Ministry of Health. Otherwise, it was scattered everywhere. So, I'm really more than happy to see that injury prevention program coordinated by the non-communicable disease unit of the Ministry of Health is going ahead with very professional events. So, and this has been one of my pet subjects. Why this is important, I know that I'm sure that you have been telling even during this conference And all the time in our country, this is the leading cause of hospitalization for consecutive years since 1995. So we need to do something because certain components are stagnating. Now coming to the session, I think this is the last session. It's very happy to co-chair with our colleague, Professor Pul Senrat, from the same specialty. You have coupled many things in this session. Community engagement, social marketing, and partnerships for effective injury prevention. Little bit of community engagement in public health, it's a critical component of injury prevention and very essential for successful implementation of injury prevention strategies. And it should be implementation of injury prevention strategies with the community rather than in a community. With those words, I will invite my co-chair to introduce the first speaker.
Thank you, Madam. There are three speeches in this symposium, and we'll spend about 15 minutes for each speech. And at the end of all three, we will have a common discussion of about 15 minutes. So let me introduce the first speaker, Dr. Sheelani Gunaratna. She will be speaking about the community-based approaches involving local communities in identifying injury risks, designing interventions, and implementing programs tailored to their specific needs. Dr. Sheelani Gunaratna is the medical officer NCD attached to the Regional Directorate of Health Services, Gampaha. Over to you, Dr. Sheelani.
Thank you, madam. Thank you, sir. Good afternoon for everybody. Now, as mentioned, NCDs in Sri Lanka, it's divided into chronic NCDs and acute NCDs. Here we are more considering about injuries, that is consist of 10%. And this is information on NCD risk factors in Gampaha district. Can see overweight in male 26.96%, female 32.73%, obesity in male 6.93%, female 13.68%, high blood pressure in male 25.53%, female 22.47%, high blood sugar in male 10.25%, female 8.09%, and cholesterol 5.33 in male and female 5.42. Disease burden from injuries, Sri Lankan context. Number one cause of hospitalization over the last 2 decades, accounting for 1 million cases per year. Each minute, at least 2 injured individuals are admitted to any government hospital. About 17 to 18% of total government hospital admissions are from injuries. Estimated number of 2 to 3 million injured persons are treated in OPDs of government hospitals or private and Ayurvedic sectors. 1 out of 5 from the whole population are affected yearly. 11,000 persons with injuries may receive health care daily. At least 8 Sri Lankans receive medical care every minute. Falls are reported as 24% of admissions. Out of total, 40% reported injuries occurred at home. While traveling, 24% of injuries occurred. Injuries kill about 3 individuals in every 2 hours. 4th leading cause of deaths in Sri Lanka. The mortality is projected to increase in next 10 years due to rapid changes in lifestyle of people. The most vulnerable are from productive age group, and it is also the #1 killer of that age. This is based on National Injury Surveillance System. In Gampaha District, outpatient surveillance, year 2023, 13,707. This year up to now, 9,498. Inpatient surveillance, year 2022, 36,639. Injury death surveillance, 530. Altogether for 2022, 50,876. And up to this year, it is 35,465. So deaths last year for Gampaha District, 530. This year, up to now, 383 due to injuries. Injuries persist as a formidable global challenge as a leading cause of death and disability worldwide. Injuries exert a substantial toll on the nation's healthcare system and economy in Sri Lanka. Health promotion at the community level is important. This requires a holistic and interdisciplinary strategy that relies on active community participation. The Safe Community program, adapted from the Global Safe Community Initiative, modified to suit the country's specific context, addresses a spectrum of health issues beyond injuries. Safe Community. It's a designated geographical area. All sectors of the community working together in a coordinated and collaborative way to promote safety and health and manages risk, increases the safety of its members. Safe Community includes safe food, safe schools, traffic, safe homes and leisure times, safe children, safe elderly, safe work, violence prevention, suicide prevention, disaster preparedness, safe public places, safe hospitals, safe sports, safe water, many more. Safety issues identified: tobacco, alcohol prevention, improved dietary habits, physical activity promotion, mental health promotion, improved air quality, cancer prevention, chronic kidney disease prevention, food and waterborne infection prevention, vector-borne disease prevention, including mainly injury and violence. So, to establish safe community in Gampaha district, we identified first the relevant stakeholders. As I told earlier, at district level, we identified district secretary, regional director of health services. At divisional level, divisional secretaries and medical officer of health. This is advocacy in 2017, started from since 2016. Advocacy to non-health sector organizations, including district secretary and divisional secretaries, followed the planning meeting co-chaired by regional director of health services and district secretary. Then advocacy to non-health sector organizations, divisional level for divisional secretaries. For each and every divisional secretaries in Gampaha district, all together 13 advocacy done. Then develop an action plan with timeline and responsibility at each divisional secretary level. Then we did awareness for health and non-health sector stakeholders and establish a multi-committee at divisional secretary level, included Grama Niladhari, Samurdhi Niladhari, agriculture officers, other development officers, economical officers, and from health sector, MOH, PHM, PHI, and many more. Then they selected one Grama Niladhari division from each MOHO district divisional secretary division. As example, Attanagala division in 2016 selected Kattota Grama Niladhari division and Wattala Handala North Jayala, Vishakawata. Like that, in all 15 MOH areas, selected one area. One area from each divisional secretary in 2016, then 2017, then 2018, altogether 45 safe communities we selected to develop. This is exchange of experience at Attanagala Regional Secretariat, that is Divisional Secretariat, after implementing first safe community in 2017. Here the officers attended, Divisional Secretary, Assistant Divisional Secretary, Medical Officer of Health, Attanagala, Assistant Director Planning, that is Divisional Secretary Office, Administrative Gramaniladari, Development Officer Planning, Public Health Inspector of the Pradeshya Sabha, Development Office, all other development officers, Sub-Inspector of Veyangoda Police, all government officials in Kattota Gramaniladari, and all government officials in Pattigoda, that is in second group and first group officers. Then carry out a survey in the locality to identify problems by the working group. It is situational analysis at village level done by Gramaniladari and all divisional secretary officers and all our health officers both together. Then they prioritized the problem and developed an action plan with time frame and responsibility. This is done by each and every divisional secretariat level, these groups, that is for each year 15 and all, for all 3 years 45. After that, they established this safe community gradually. They developed various things, and we reviewed the progress of activities periodically at safe community, at Ministry of MOH and Divisional Secretariat level, that is at grassroots level. We visited each and every house in the district that is established this safe communities. Visited by MONCD from RDHS level with district secretary level, planning, director, district secretary. All Gramaniladharis here you can see, and various other people. We went each and every house to see what they are establishing as the safe community program in their houses. Then review the progress of activities periodically at safe community district level, that is 3 times for the year conducted review meetings, chaired by district secretary and co-chaired by district secretary and regional director of health services, with directorate NCD, Cancer Control Unit, YED, Health Promotion Bureau, and here you can see district secretary, previous district secretary, Mr. Sunil Jayalat, addressing and reviewing the process. These Gramaniladharis and our health officers were presenting the progress. Results. For injury prevention, you can see various things here. These gas cylinders, they kept outside the house. In each and every house, for these first aid kits, they established these things for first aid. And this home safety checklist they implemented in each house. Our midwives, they have given health promotion program relevant to those home safety checklists. They separated these various poisoning matters and things separately they kept. And this is unsafe wastewater drainage in CIC factory. This is done by PHI area, JAL MOH area. mainly PHI, JAL, they implemented this. You can see before and after pictures in 2017. In Vishakhapatnam, that is again Javala accident prone culvert, before and after you can see, done under this program. In injury prevention in factories, Melva Metal Work Factory, first aid unit, before and after you can see. And prevention and reduction of strategies caused by road accidents, they have taken many measures to improve the knowledge of these villages with police. Not only injury prevention, agriculture, they did many more to improve agriculture, home gardening. These are our collective effort, that is collective effort by MOH team and divisional secretary team. Again, you can see the same process. Then healthy diet for school children. They have started Suraksha Sarya. That is a mobile van that carried various food, healthy food for school children. Parents, in the morning, parents could buy those food. This is Sinikurulla, again from Jail area. This is a traffic light system again in 2017. Our PHI given to all safe community places, homes. This Sinikurulla picture with 31 balls here. And every day they can mark it as red or yellow or green according to the amount of sugar that they used. And finally, at the end of the month, they can assess themselves, householders can assess whether they have used, how many sugar they used for each day. This is salt usage. They have mentioned this in a calendar in the kitchen, and they check whether they are using more sugar. This is storage of salt before and after, correct storage after. And this is for the waste management. They have this is Tiharia area. They made these bags for waste management and various methods they use to manage waste. And here again waste management. This is various MOH areas in Gampaha district, not in one place, not a one place. This is Nigambu side. They have placed a notice board explaining the importance of not dumping waste in the lagoon. Then kitchen management 5S. They did various things really. We felt that these houses and these kitchens are better than our ones really. To that level, they did it. Then physical activity program, they started in every safe community for school children, for village people, night classes. Even 85-year-old ladies were practicing physical activity in those programs. Self-employment opportunities, then art competitions, no tobacco areas, and medical camps, NCD screening camps, and they did data analysis also. And this is spiritual things, MCH activities, Sitamukanta Pola special programs, counseling, mental health. Like this, lot of various activities we established in those safe communities. Suggesting let's light a lamp for the nation. Thank you.
Thank you, Dr. Sheelani, a very interesting and very practical presentation. So we'll take up the questions at the end of all three presentations. So please remain in the audience. Thank you very much. So, so let me hand over to my co-chair to introduce the next speaker.
Ladies and gentlemen, it's a pleasure to introduce the second speaker, whom I know for more than 3 decades, Dr. Vinya Ariratna. He is the President Sri Lanka Medical Association and also the President Sarvodaya Shramadana Movement. Dr. Vinya Ariratna will be online, virtually connected to us. Dr. Ariratna, you have 15 minutes.
I will be very short because I'm quite conscious of the time. I think running behind the schedule. So the topic that has been assigned to me is a long topic, public-private partnership.
Action Area 1 itself, you have identified advocacy, partnership, and leadership. So that shows how much of a emphasis or importance is attributed to partnerships. When you look at a little bit more closer to the strategic action area 1, there are many interventions proposed, national and subnational mechanisms of multi-sectoral action established and functioning, then establishment of community village level injury prevention working groups, then national and subnational mechanisms of multi-sectoral actions established and functioning, then establishment of community village level injury prevention working groups. Now, I represent both the professional association, which is the apex medical body in Sri Lanka, the Sri Lanka Medical Association, at the same time, a grassroots non-governmental development organization, the Sarvodaya movement. So I'll pick from few areas of my own experience and try to then answer the question, what are the benefits, what are the challenges of partnerships, and not just in private-public partnerships, because I'm not a big fan of private-public partnerships in all areas related to health, because sometimes we ignore the other sectors which are important, which can make a difference. So one thing that I noticed even in the multi-sectoral strategic action plan on injury prevention and management in Sri Lanka is that it does not really identify who the partners are. So it's mainly the government sector and really not mentioning even the private sector. So I find it quite interesting to see how we can really engage other partners as well. So when you look at injury prevention, we have very important partners. They are communities and community-based organizations. Then we have the civil society organizations, which are sometimes also identified as non-governmental organizations or NGOs. Then we have faith-based organizations. Different religious organizations can play a very important role in injury prevention. Then the private sector, of course, and then academia. Then professional organizations like SLMA and also the other specialties can play a very important role. And not only the medical professional associations, but also other professional associations such as Institute of Engineers, Institute of Architects, because they can also have structural designs which will prevent injuries based on the current epidemiology of injuries or the patterns of injuries in Sri Lanka. The safety is everyone's concern. Then local government bodies are very important. I don't see that those being mentioned here in the plans, but I think they are very important. Then, of course, the ministries, the main government agencies. So within this context, I start with the community. So we, as a grassroots organization, have been promoting, identifying what are the common health problems in the community and trying to really impart very practical knowledge. Now, this is one example of what we call a Suodaya program, where we have identified key issues that have a big disease burden in the community. Malnutrition, NCDs, then also on disasters, and of course now injury prevention. So we can incorporate some of these very practical ideas, how to make your home safe, how to make your community safe, based on actually the reported pattern of injuries, because I don't think we should always tailor-make the kind of information that is relevant to the community. Some risks that are encountered by one community in one geographic area may not be the same in other areas. But of course, we have a generic pattern. We know some injuries are common, whether it is in the north, south, or central province, or wherever. But while giving those, we need to also look at what are the risks and what are the injury patterns specific to that kind of area, as well as to various professions, trades, and other settings like schools. And I think that's very important. So you make partnerships. Now, earlier I have listened to another presentation in the previous breakout sessions. There were like how other partners like Sri Lanka Lifesavers, how they were contributing. We have also partnered as civil society organizations with both other non-governmental organizations which are specializing in, say, drowning prevention and also first aid and things like that. So this one such program where we were training first responders in the community lifesavers, and within a certain program covering 12 districts in Sri Lanka. And then the results have been very encouraging. In those districts, we have been able to have these trained youth who can contribute to injury prevention as well as saving lives when an incident happens. But of course, we have to, the impact is measured from whether we are able to bring down the hospital admissions on injuries. So we are in that phase now. In those areas, can we really see a pattern where such injuries, the reported injuries, are coming down, the incidents? So we partnered with, just not the non-governmental organizations, but Sri Lanka Police has a very good team for life-saving. So partnerships are really tapping the expertise of different organizations. Then, of course, the Disaster Management Center, particularly when it comes to drowning prevention. Then within the government agencies, we have specialized agencies for different types of situations where we need to engage. So we have to look at in developing partnerships, who are the agencies in the government, who are the agencies in the private sector, who are the relevant agencies in the academia or specialities in different professional associations who are relevant. So it's not about calling everybody to a meeting and say that this is our plan, let's work together. No, I think the results are really achieved only if you focus and really tap the best expertise of each organization. So then I like to shift to the SLMA partnerships. SLMA has an expert committee on prevention of road traffic crashes, headed by Professor Samath Dharmaratne, who was the immediate past president of Sri Lanka Medical Association. And this is a model program. I think we have created a platform for road traffic accident prevention, which is very inclusive, which is led by, of course, the experts who are working in the expert committee, but we are involving the Sri Lanka Transport Board, Sri Lanka Insurance, and also the police department, So it is very important that collaboration happens in equal footing, equal platform. Then we look at also engaging the private sector as well. Now in this particular program, I'm sure my colleagues who are in the expert committee of SLMA are here, and they partner with e-channeling, the SLT Mobitel Rotary, which is a voluntary organization, then Save Sri Lanka and Lions as well. Then to answer directly and finish my presentation, what are the partnerships of, what are the benefits of partnerships? So we have a situation where leveraging the diverse expertise is only possible sometimes if you partner. You can't have in-house expertise for everything. So we leverage this diverse expertise if we have partnerships. Then resource sharing has to happen. Resource sharing is when you are not having enough resources to do it yourself, but also there are not just financial resources, but there are technical resources. So you can have a bigger and a broader impact on this. And then, of course, by partnerships, you can reach groups which are not generally reachable through normal programs. So when you partner with a non-governmental organization, a civil society organization, or a religious organization, it opens up a new constituency to which you can reach. That's another benefit. Then, of course, we have to innovate models. I think constantly in the health sector, in addressing health problems, we have to have innovation. So when you have partners working together, you can come up with new approaches, new models that can solve problems. Then finally, advocacy and awareness doesn't stop at one point. If you have partnerships, it disseminates, you can sustain the messages, it can be reminded. So partnerships bring in those key benefits in injury prevention. However, there are major challenges. As I have mentioned at the beginning, even this, our report, our strategic action plan, does not specifically mention some of the important partners. So we still don't seem to have that culture of partnerships. It is the spirit of partnerships. It's sometimes we like to contain into one compartment, and we don't want to give up our, control over certain things. But if you have to address some of the key public health priorities, you really need to have a culture of partnerships, give and share. Then differing objectives and priorities, particularly in the public-private partnerships. That's why I said that I'm personally a little bit cautious when it comes to so-called PPPs, because a private sector organization would also always be looking at profit, and that is fair enough. I mean, these private entities are shareholders, and they like to have a return for their investment. But here, the investment may not come directly in the form of money. Saving lives will also, of course, save a lot of money, but it will not carry a direct benefit to sometimes for those private sector organizations. So there can be an incompatibility of objectives. Then resource imbalances. So sometimes when we partner, some organizations can only bring in small resources, some are very big. So there is an unequal power balance. You have to manage very carefully. Otherwise, what happens is the entire program can be then taken over by a certain party which will have some other ulterior motives. Then resource imbalances, the same. It is that's the resource imbalances. Then complex governance and coordination. Who controls? Who gets the credit? All these things happen. So in a partnership, you have to have a clear definition of roles and responsibilities. Then how do you sustain such partnerships in the long term? Maybe in my tenure as the SLMA president, I may start something, but it will not be sustained because the same commitment may not be there from the organization the following year. So you have to have a commitment that lasts long. I mean, we have demonstrated in SLMA, particularly when it comes to road traffic crashes prevention, we have that ongoing long-term commitment. Professor Samath Dharmaratne and the team. It's a dedicated team somehow sustained this for years and years. So that's a good example of partnerships where we sustain for long-term impact.
Then risks and accountability. Who is accountable? If something goes wrong in a partnership, people will just try to wash their hands off and say, no, we were not responsible. That's not in the spirit of partnership. We have to face risks. We have to analyze risks and also be accountable. Finally, in most of these efforts, we generate knowledge, we generate new knowledge, we generate techniques. So who owns? So intellectual property, sometimes we write a paper and then publish. So sometimes if you are not understanding at the very beginning, this is how we manage the information, the knowledge that we generate, then there can be problems. So these are the challenges for partnerships. And I'll end here. These thoughts really capture the essence of the challenges and benefits of partnerships, and all our intention should be to have a shared vision, mutual respect. If it is there, we can address these challenges and clearly define roles and responsibilities amongst partners. So let's partner to save lives. Thank you.
Thank you very much, Dr. Vinya Ariyaratne, for your very informative presentation and also providing a very practical experience gain in developing partnerships. And you managed your time very well, exactly 15 minutes. Thank you, Vinya. Okay. The audience will have the opportunity to ask questions later. So let me hand over to co-chair to introduce the third speaker.
So let me introduce the third speech. It's about digital technology. We all know that we are in a digital era, and we have to use them very effectively, efficiently, in order to address or provide solutions to our problems. So it's a very good opportunity, and I am the privileged to introduce Mr. Tarusha Vanigasekara. He's the unit manager, Digital Innovation and Inclusion at Dialogue Axiata Private Limited Company. And he's also has done a lot of digital solutions for various exam problems. He holds a Bachelor of Science degree in Mechanical Engineering from Midwestern State University, USA. And he's a certified Scrum Master. So he has a lot of experience there. So over to you, Mr. Tarusha. That's all right. Yeah. The topic, everything. So on behalf of the organizers, may I apologize for the wrong name and the designation, there. So I think it has to be corrected. Yeah, okay.
Just to say something, this is where you go wrong when you use technology, copy and paste. Huh? You are carrying the same destination from the previous speaker.
It's working? Yes. Thank you for the organizing committee for giving us this opportunity. So I think my introduction was done. So I'm Tarusha from Dialogue. I'm from Group Sustainability itself. So my topic today is basically how we can use technology to drive powerful messages, creating awareness, as well as behavioral change, right? So before I get to my presentation, before I get to my slides, I would like to speak a few words of why we have to do this, why this is important. So I think throughout these 2 days, yesterday and today, we have learned what is an injury, how important it is to prevent it, and how to create awareness, and how important is for all of us to come together to solve this problem. This is a major issue. We are losing lives for things like that we can prevent. So with that note, I want to discuss how private sector can make a change. Basically, coming from a telecommunication company, Dialog Asia PLC, not just Dialog, all the telecommunication companies, we reach out to people every day. We have access to send them a voice call, a message every day if there's an emergency. So utilizing this technology is very important. In terms of Dialog, we are reaching out to 17 million customers daily in 17 million customers are connected to our services. Not just, it can be internet, it can be Dialog TV. So as a company, we feel responsible to make sure that we utilize these services to drive change as well. So talking about these factors, now there are 17 million customers. How do we do it? I have 2 words. The name is digital inclusion. To make sure that whatever we do is accessible for everyone. So we have a framework we call the 4A framework that we follow for digital inclusion, which is availability, affordability, applicability, and affinity. This basically guides us when we do services like this to make sure that it is accessible for everyone, affordable for everyone, that they can use it at any time. So this is where, this is how when we implement services like this, and when we utilize our services to help the community, we make sure we look into these. So again, most of us now, we have a supercomputer in our hands, right? Our smartphone. So the possibilities are endless with this small device. The smartphone penetration, being a telecommunication company, we have seen it has rapidly increased over time in all part of the segment, not just in Colombo or the urban areas, but everywhere we have seen the smartphone penetration going high and the data usage going high. But there's a small problem. That is that people see this incredible device just as a communication device or an entertainment device, right? So that is the problem that we see, but we are trying to make sure that they see this as a livelihood device, a safety device, and for an assistive device for persons with disabilities. There are the opportunities are endless. If you think about it, this is a supercomputer that can do so many things. So I just want to talk about one project that we have done, which is Sairu, I'm now coming to my presentation, where how we have used technology to drive change, to make behavior change, and also prevent injuries and save lives. So coming to my presentation, Sairu is a weather-based advisory service for fishermen. We are partnered up with the Department of Fisheries and Aquatic Resources and Department of Meteorology. So there we are not just giving this information. There's a regulatory body who enforces this information and makes sure it is on time and it is also correct and accurate. So starting off with the project, we didn't want to start off with an app. We know people use our services. The voice services reach out to more than, most of the people. So we start off with a voice service and a message service, which is not just English. This is trilingual, free of charge, weather information, location-based. We have segmented the country into 7 segments in the country where fishermen are at, and then we send location-based weather information daily, as well as emergency information as well. So that's how we started off. we have reached out to more than 95,000 fishermen already. We launched this product in 2019. So throughout this 3-year process, we have sent more than 360,000 emergency warning calls, 5.2 million total number of SMSs regarding weather and emergency. As I said, we have reached out to more than 95,000 fishermen in the community. So in terms of the numbers, if you are not aware, so this was targeted to day boat fishermen. Multi-day boat fishermen, they do have the technology to prevent so many injuries. They have the sonars and the technology that needed to save their lives. But day boat fishermen do not have access to this information at the right time. They might listen to the radio and get the information, but if there's an emergency, if they don't listen to it at the right time, their life might be in danger. So this is why we implemented a device for day boat fishermen to provide accurate and information at the right time, creating awareness at the right time. So that's why we started Cyru. So I think to talk about the emergencies, the services that we have done, I think it's very important that we disseminate the information at the right time. So we were able to disseminate information during these cyclones, even at the Express Pearl accident, for them to create awareness. Okay, it is not safe to go out to the sea today. So things like that. So these are in terms of the numbers that we have sending the information to fishermen at the right time. So again, partnerships are very important. We don't want to reinvent the wheel. We have the technology, we are using it to create awareness, but we need our partners to help to make this cause a success. So not just the Department of Fisheries and Aquatic Resources and Department of Meteorology, we have all these partners helping out in some way to make sure that not just weather information is carried out. So like how to save their lives, what are the precautions that they can take. So all of this information is sent to them through Cyru. Again, thanks to our partners. So we started off with the voice services. I told you the affordability and availability. So if they don't have a mobile phone, or their literacy rates might be very low. So that's where we started off the Cyru TV, making sure that we have a Cyru TV embedded in each harbor. If they don't have a phone, they can get to know at the emergency services at the harbor. They can come and see at the harbor. So these TVs are updated daily at 4 p.m. and updated through the department. The information is taken and updated through the department. This is not something that we do manually for each TV. This is handled by Wi-Fi through a centralized system. So the technology is used and optimized so that it is accurate and it is updated frequently. So if you see the color coding, I think that's where the simplification. Digitization is good. Using the technology is good. But if it's not simplified so that the people won't understand it, that's bad. So that's where if their literacy rates are so low, we have used the color codings as well, so that if the green, they know by default it's okay to go. If it's yellow or amber, danger might be there. Red, not to go. Things like that, we have simplified it so much so that our customers get the accurate information, which is very vital. So in terms of putting up the TV, so we have so far at 10 harbors, we have done it. We want to carry this out for other harbors as well, make sure that we carry out this project. So in terms of available of funding, right now we have done 10, but we want to do more in the future. So why stop there? We know the smartphone penetration is going high. We know the data usages are going high. So we thought of getting an app as well. So we are ready to launch the Cyru app next week, within the next 2 weeks, where now they can do various things. The app will be, through the app, the weather services will be free, but they will pay a small amount. Again, affordability is something that we look into, where through the app, they can use other services like marking their route. So as I said, utilizing that supercomputer so that they have all the equipment that a multi-boat day fisherman has. Now they have GPS. Now they have a way to notify if they are in a cellular coverage. These dayboat fishermen normally go like fish in 20 to 30 nautical miles, where most of our signal covers not all the areas, but to some level 20 nautical miles is covered through our cell towers. So if they have the signal, they can use this emergency beacon to notify their emergency contacts. So things like that are now available through this smartphone app. So this is what we have done through the Cyru app, which is we are launching pretty soon. So I think talking about all of these, we have seen people using the technology, making it as I said, making the smartphone a livelihood. We have heard that when the TV is switched off at the harbor or the TV is not functioning, we get calls saying we want this activated. So now they have made it a practice to check the weather or the warnings before going into the sea. So the technology has done a part where we have, through these simple technologies, we have created a behavioral change. We have prevented injuries and saved lives. So even, I think, one testimonial, so before I finish my presentation, few months ago, a customer came looking for a customer agent at Dialogue, said, Cyru saved my life. So he got the emergency information at the right time. Because of that, he was able to save his life, because otherwise he would have gone into the sea and lost his life. So this is the power that we have to drive change, save lives, and prevent injuries as well. So to conclude my presentation, simplicity, digitization can make a big change, and driving digital inclusion is very important. Thank you.
So thank you very much. So we have listened to three very eminent speakers on three different topics relevant to injury prevention. And the first one was on the community engagement, and then how to sort of engage stakeholders by Dr. Vinyari Ratna, and the last one is about the digital innovation. So now the symposium, the speeches are open for discussion. If you have any questions, so we have about 15 minutes time for the discussion. So if you have any questions, please focus on your question, be focused on your question, and direct, if you wish to direct the question to a particular speaker, please mention so, right? Please raise your hands if you have any questions, so please pass the microphones.
This is regarding the final presentation. Actually, they said that their coverage is 20 to 30 nautical miles. And I would like to know whether have you developed any amplification and external coverage appliance which can attach to your smartphone to benefit for the people who do very distant fishing.
Thank you very much for the question. So yeah, the technology is there, but it's a bit costly, I would say, in terms of, so there are signal amplifiers. As I said, to some level, if you know that the route that you're going into, they can know the extent of signal at different locations. But if it is not, there are signal amplifiers that they can take in. There are like various technologies. We have researched about it as well. But implementation and, the sustainability of the product is a bit questionable at this point with the, the current foreign forex, the currency rates as well. So it is there, the technology is there, but yeah, working towards it is something that we are researching right now. We have to implement it to some level.
Have you, the other one is, now you said that you have sent millions of SMSs over these different issues.
Yes.
Do you have a feedback corridor to analyze your service by the users? I mean, have you analyzed the feedback of your SMSs and how useful was it for the users?
Yeah, so I think as soon as we launched this product, the COVID hit, and then there were other issues. But we have done our research. We have conducted ground level research, saying that I think most effective method was the call, because we like if the person so we try twice. We don't just when they hang up, we just or if the signal is not there, we just not stop there. We send another call within the next 5 minutes, right? So I think calls have been the most effective. Also messages, in terms of when they miss it, they have also looked up to it. I think simplicity of the message and the language has also helped them to understand. So we are doing like yearly ground research to some level to get feedback. That's what we have seen so far. Then that's how we have seen the people. So we have different requests saying, so when we did the app, when we developed the app, making the route, the marking the route part, and the emergency beacon. So those were things that the fishermen requested. Give us these services so that we can implement it. So that's how we have done it so far.
And one final question. And do you have in that app, do you have a emergency platform for the user so that he can quickly access the shortest emergency support team? Do you have that access?
I think we are implemented with NARA. Yes. So that part is there. So basically, to the closest, as well as we send the information to emergency contact as well as the authorities.
Who are the government stakeholders who are involved in emergency supply service in Sri Lanka at the moment with your application?
So application is mostly NARA is there, and then we have, as I said, the partners. MIPA is with us, Department of Fisheries. So those are the government organizations as well as the Navy.
Thank you very much.
Are there any more questions? Yes, there. Right.
It's regarding this digital health and mobile health interventions. My question is then, as a private organization, or you are aiming at profit. So when we are applying this health application, how you make it profitable? Or at least say if you are running by a program, suppose it is health ministry program, at least there is some operational cost in this application. So for the servers or the whatever the things. So at least to cover the operational cost, how you can make these apps profitable while keeping the quality of that app. That is we are not aiming at the higher profit, violating all our ethics. Not like that. How you balance this thing, keeping the quality of the app and make it profitable?
Yeah, I think to answer that question, I think the call services, the voice service is free, but the app is not. Right, so it is we charge them affordable amount, let's say rupee per day or 2 rupees per day. That is how we are planning to make it sustainable, right? We don't like to call ourselves CSR at this point because it's not like when, let's say, with the current situation of the country, we can't do that. It's not sustainable. And also what we have done is our plan is to not create an ROI, rather than our plan is to make it cost neutral for the company. Again, for the Sairu, the business case, I would say that we are planning to hit cost neutral within within 2.5 to 3 years. So that until that, the company will bear the cost, but we are planning to hit the cost neutral level. Again, charging the customer a right amount of time. Also, that gives us accountability to provide a quality service. That holds Dialogue and the rest of the partners accountable to make sure that we provide a quality service. I think that's.
Thank you very much.
I think we have few more time for a few more questions. If there's any, please raise your hand. Yeah. Does anyone have a question? Yeah, Dr. Utpala.
Now, in Health Ministry, Health Promotion Bureau, we have 661 digital signages connected throughout the country with the primary care institutions. So we run the same channel by Health Promotion Bureau, but we face, actually this goes to Tarusha, we face the connectivity problems all over the island. And also, end of this year, we are facing a lot of difficulties in the sponsorship on connectivity and other things. So digital connectivity, we are running this through the internet facility the same way. And we need very small bytes for just to, throughout the whole day, we put only 2 times new programs, new channel, a new program. 2 times daily. So, but with that also our hospitals faces a lot of difficulties in connectivity. What are your solutions and whether we can collaboratively work for those solutions for this network to expand as well?
Definitely, definitely working together is something that we want to do. As I said, we believe in partnerships. We never want to reinvent the wheel. So I'm happy to have a discussion in terms of how we can help. In terms of Dialogue connectivity, we have coverage covering, I can say for sure that we have covered 95% of the population through voice, but not in terms of data. But yes, we are covered. We are constantly working on improving our coverage. I think I think we have the largest coverage, and so in terms of there are similar slots where some areas that is not covered. Yes, as the company is working to cover those as well. Definitely happy to work on implementing whatever collaborating to the project.
Okay, I have one question to Dr. Vinya Ariratna. Hope you are connected. Dr. Vinya, is there a way that we can get Dr. Vinya on screen? Yeah, Dr. Vinya, my question is about the multi-stakeholder, partnership, the engagement. So in this, I know it is very important, not only for injury prevention, for any public health issues. So have you, or has anyone mapped the stakeholders and their connectedness? Because that is very important for us to understand their dynamics with respect to the technical flows and financial connectedness. For the injury prevention, was there any such effort, and what was the outcome of that, if there's any?
Good recommendation, and I think the others can also follow. Now, the issue is that in the health sector, the partnerships are not very well coordinated and managed. So you have, partnerships for NCDs, partnership for mental health, partnership for palliative care. So I think it's a good suggestion if we can also do a mapping and see how we can strengthen partnerships. I think if Health Promotion Bureau, Dr. Utpala is here, I mean, if they can take the leadership, we'll be very happy to support the mapping exercise and to measure the success of different interventions by through these partnerships. Thank you.
Best in optimize the resources because certain units or persons can be used for multiple tasks as well. So thank you very much for your response.
I think no more questions. And we want to thank all the presenters and, of course, the audience for creating very interesting concerns. Thank you.
Thank you, Madam and Sir. Following that very enlightening and admirable plenary on how community engagement, social marketing and public-private partnership can prevent injury, it's time to pay tribute to our renowned resource persons. I warmly welcome Dr. Lakshmi Somatunga to present the token of appreciation to Mr. Tharusha Vanigasekara. Yeah, we can go on. Also, Professor Upul Senarath to present the token of appreciation to Dr. Sheelani Gunaratna. Thank you, sir. I most cordially invite Professor Mark Stevenson to present the token of appreciation to Dr. Lakshmi Somatunga and Professor Upul Senarath. I welcome the speakers and our chairpersons for a good group photograph. Thank you. And while we prepare for our award ceremony and the closing remarks, I would like to make an announcement that a vehicle key was found in the male washroom. So if one of you all have misplaced your key to your vehicle, you can come up to the table next to the control panel. Thank you.
I hope you all enjoyed all those interesting and entertaining sessions. And now is the time that you've been waiting for. It's time to announce the winners for the best oral abstract presentations. And I would like to respectfully invite Dr. Lakshmi S. Somatunga, the Additional Secretary, Public Health Services, to present awards to the winners. Session 4, Best Oral Abstract Presentation goes to Can school teachers be lifesavers? Knowledge, attitudes, and practices of school teachers regarding school injury prevention, basic life support, first aid, and care for the injured victims in Wahare Medical Office of Health Area in Batticaloa District. Dr. L.P.I.U. Patirana. Session 5. The Best Oral Abstract Presentation Award goes to Fall Incidents Among Hospital Inward Patients in Teaching Hospital Karapitiya and Related Factors, Dr. N.H. Ubesekara. Session 6. The Best Oral Abstract Presentation Award goes to Musculoskeletal Disorders, Associated Factors, and Health-seeking Behaviors among Small-Scale Handloom Weavers in Kalmunai Regional Directorate of Health Services Area, M.A.M. Hilmi. Thank you, madam. And please stay on stage for a group photo, please. And the winners of the oral abstract presentations, please come forward for a group photo. Dr. L.P. Ayu Patirana, Dr. N.H. Ubesekara, and Dr. M.A.M. Hilmi. Dr. Hilmi? Right, okay. Thank you very much, madam. And now it is the tail end of our program. And to conclude the program and to give the closing remarks, I would invite Dr. Nimani on stage.
Good afternoon, ladies and gentlemen. And we have now reached the end of 2 very fruitful days, gaining knowledge and sharing information on prevention of injuries. Various aspects were considered in the last 2 days, and the conference was conducted under 9 thematic areas. In closing, we will now have a synopsis or summary of the conference and future directions as well. And for this synopsis, I would like to call upon Dr. Samitha Siritunga, Consultant Community Physician, Injury Prevention and Management, Directorate of Non-Communicable Diseases. Over to you, sir.
Aiboan again. Thank you very much, Dr. Nimani, for inviting me to give a summary of the final remarks of this 1.5 days sessions that we have had on injury prevention. Actually, we discuss this 1.5 days, we discuss many areas on injury prevention and many things about the injuries. What are the causative factors, risk factors, how can we prevent all these, and what are the strategies that we can adopt, and all these things, most of the things we discussed. And we had 3 plenary sessions. Those are injuries and economic burden,
injuries and climate change, community participation, community engagement, public-private partnership, social mobilization, social marketing. And we had 9 symposia. Those are road safety, drowning safety, poisoning safety, animal safety, occupational safety, child safety, elderly safety, data management, post-trauma care. We had 9 symposia on those 9 areas. We had 6 free paper sessions selected from the abstracts we got from various parts of the country, and we had actually we selected number of free papers to be presented at the conference. Out of those things, finally, actually, after going through all these sessions, we found that the conference emphasized the importance of interventions by policymakers to better prevention of injuries across the country. We wanted to highlight that one because in each and every session, we got to know that most of the speakers and also the audience, they emphasize about the importance of policies and how to implement all these policies related to injury prevention. At the moment, we have policies, acts, regulations, but the problem is, for some extent, it is the practicability is not there for all these. Therefore, these are the things that we need to emphasize, and future directions, what we have to think about when we consider the injury prevention program in Sri Lanka. And I would like, if you have any suggestions, what mechanisms we can have to solve this problem, because even though we have policies by the policymakers for the better prevention of injuries across country, how can we utilize the policies, and what is the role of policymakers in implementing all these things? Therefore, I think I am not going to ask the questions from the audience to get some answers. And if you can share your ideas with us, I think it would be much, much better to streamline our program. The other one is the conference. The many areas emphasize the importance of multi-sectoral involvement. And final session also was on multi-sectoral involvement, public-private partnership, and social marketing, and so on. One questions also raised about the mapping of multi-sectors. Actually, to give some kind of answer for that one, when we were developing our multi-sectoral action plan on injury prevention, we tried to identify the relevant stakeholders. Actually, we mapped those to identify the different activities, different roles of the different sectors. Injury prevention, for me, it's not a simple area, because it's a vast area. And injuries, when we consider in our injury surveillance also, we identified different injuries, like starting from road traffic accidents, poisoning, animal bites, animal attacks, burns, fires, fire-related injuries, poisoning, drowning, and those things are, and falls. Those are very common in Sri Lanka, and we identified 23 different types of injuries. Therefore, stakeholders who are involved in these for the prevention, or who are dealing with these things, are also different. Therefore, it's not a simple activity, simple exercise to identify the roles, but for some extent we identify. But the thing is, how can we engage, even though we identified these different sectors, how can we engage with them? How can we coordinate with other sectors for the prevention of injuries in Sri Lanka. That is another area that we have to look into. The other one is at least the conference emphasized the importance of having better idea of the cost associated with trauma, mainly its management. To avoid this problem, we need to find out some ways, because then only we can have some kind of idea about the burden of, there is burden by, not by numbers, but by the financially, what is the burden of injuries in Sri Lanka financially? Because we know that not only for the management, the treatment of of injuries, many out-of-pocket expenditure is much higher than that. And sometimes we know that medical cost is also some billions. Therefore, we need to identify the cost of this for the management, and what is the cost for the injuries. Therefore, if we can reduce that one, we can utilize that money for other essential things. I think for me, I think almost all you may agree with me. Injuries can be prevented if we take little attention and little precautions. Each and every injury can be prevented. But the problem is we want to change our attitudes and behavior. We have knowledge, but we need to change our attitudes and behavior. Then only we can prevent all these injuries. Finally, in terms of injury prevention, the importance of data is also emphasized. Because now data, we collect so many data related injuries. Now injury surveillance in one hand, and Sri Lanka police and other researchers also collect some data. Therefore, we want to integrate all these things to see a correct picture of injuries. Therefore, in terms of injury prevention, the importance of data is emphasized. Furthermore, data on injuries are collected by different sectors and do not appear to be integrated. Therefore, it's very difficult to see, get a better idea of injuries, the burden of injuries, pattern of injuries. Therefore, after this conference, highlighted these things to be considered in future directions when we are planning our injury prevention program. Therefore, I must thank, because we wanted to have a small panel discussion on this one, but because of the time constraints, we are not going for that panel discussion. Therefore, we would like to hear you about all these main 4 problems. That is, what are the policies? How can the policymakers involve in implementing these programs, injury prevention programs in Sri Lanka? The other one is, how can we involve the multi-sectoral involvement, coordination? Because even though there are so many people are working on injuries prevention, how can we engage with them? The other one is costing. How can we know the financial expenditure or the financial problems of this one? And finally, importance of data research. How can we improve the data systems and the knowledge on injuries through data by improving the data systems and also the research. Those are the few things that highlighted throughout in summary, throughout the conference. I think those kept. We will have to consider all these when we are planning in our future directions. Therefore, I must again thank you very much for all of you. This is not the vote of thank, but I must thank all of you. If you can share your ideas on these basic 4 areas, because then only we can have a better idea and have a better idea about the prevention of injuries in Sri Lanka. Thank you very much.
Thank you, sir, for that synopsis. It has indeed been a very fruitful and productive 2 days at the Injury Prevention Conference. We have now reached the final component and a very important component of this conference, that is the vote of thanks. And for this, I would like to invite Dr. Irshad Mashood, Registrar in Community Medicine attached to the Directorate of Non-Communicable Diseases, to propose the vote of thanks.
Good afternoon. The International Conference on Injury Prevention held in Sri Lanka aimed at averting injuries and coordinating a comprehensive response across various sectors. I express my gratitude to those who guided and supported us in ensuring the success of this conference. First and foremost, sincere thanks to the Honorable Minister of Health, Dr. Ramesh Patrana, for gracing the event with his presence. The success of this significant gathering was greatly enhanced by his attendance. I extend my appreciation to the Secretary to the Health, Additional Secretary to the Public Health Services, Additional Secretary to the Medical Services, and the Director General of Health Services for their diverse support in orchestrating this successful event. Special thanks to the Deputy Director Generals of Ministry of Health and Directors of the Ministry of Health for their invaluable contributions. The international dimension of the conference owes much to the expertise of our international resource persons, and I extend a heartfelt thank you for making the conference vibrant. I have to express gratitude to the speakers, chairpersons, judges who transformed the event into a professional gathering over the last 2 days. Further, my gratitude also goes to the professionals who assist us in coordinating with resource persons. I would like to acknowledge the support of the sister directorates of the Deputy Director General of NCD, specifically Directorate of Mental Health and the National Cancer Control Program, for their collaboration in organizing the event. Dr. Champika Wickramasinghe, Deputy Director General of Non-Communicable Disease, played a pivotal role in initiating and supporting this project, serving as a backbone of the event. Thank you very much, Madam. Dr. Samit Samarakon, Director of the Directorate of Non-Communicable Disease, provided guidance and support with her positive approach, contributed significantly to the success of the conference. Thank you very much. Dr. Samita Siritunga, Consultant Community Physician, National Program Manager of Injury Prevention and Management, Head of the Injury Unit at the Directorate of NCD, emerged as the planner of the event, guiding us at every juncture. Thank you very much, sir. Special thanks to Dr. Shereen Balasingham and Dr. Arundika Senaviratne, Consultant Community Physicians of Directorate of NCD, who were key figures in planning and organizing the event along with other staff members. Thank you very much, Madam. I take this opportunity to express my gratitude to my colleagues, senior registrars, registrars, and medical officers at the Directorate of NCD and DDG office of NCD who face challenges to make this event a success. Thank you very much. The unwavering support of the Directorate of NCD staff throughout the activities was commendable. I extend thanks to the support of the drivers and the staff from the transport division of their contribution to the success of the event. A word of appreciation for energetic comparing team for their valuable contribution despite their hectic schedule. I extend special thanks for the support offered by postgraduate doctors in medical administration and the College of Medical Administration, particularly acknowledging the contribution of Dr. Kanchita, Dr. Kasun, Dr. Regington. I would like to acknowledge Dr. Shiromi Madhuwage, Consultant Community Vision, and her team from College of Community Vision, Sri Lanka. I extend thanks to Dr. Clive and his team, Mr. Pasan and Mr. Abhilash, who supported us from the beginning to make this program successful. Gratitude to our sponsors, George Stewart Health Private Limited, Technomedics Private Limited, and Dialogue for their contribution to the file folders. In addition to that, I would like to thank Sri Lanka Insurance their support to print the agenda. A special thanks to the stakeholders of SALT and appreciation for Mr. Chaminda, Mr. Hasant, and their team at Water's Edge, as well as the AV team of Mr. Piyushan for their support. Last but not least, heartfelt thanks to the participants of international conference from all the corners of the country. Your presence was instrumental in the success of this event, and I am sincerely grateful for your support. Crafting this vote of thanks for such a grand event is no easy feat. I acknowledge that there may be inadvertent omissions or errors in mentioning names or contributions. I kindly ask for your forgiveness if there are any such oversights. Once again, thank you all for your guidance and support in making first international conference on injury prevention in Sri Lanka a resounding success. Have a wonderful day.
Ladies and gentlemen, the vote of thanks may be over, but we have one more individual that requires our gratitude. On behalf of the Deputy Director General of Non-Communicable Diseases, the Director of Non-Communicable Diseases, consultant community physicians, and the staff, they would like to all extend a very special thank you to Dr. Irshad Mashood. Who has tirelessly coordinated and managed this event today. So once again, a warm round of applause to Dr. Irshad Mashood for a job well done. And now, ladies and gentlemen, we have reached the end of this conference. Therefore, we would like to invite all of you to partake in lunch and refreshments. And we have all understood that prevention of injuries is imperative and that this endeavor has indeed been a fruitful and productive one. And I hope that this will enable all of you to promote bridging gaps and saving lives. Thank you and have a wonderful day.